Hello everyone, I am Dr. Ziyad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding. In this tutorial series, I will walk through Model Paper 1 for the AAPC CPC Examination. I will share quick techniques to find answers very easily, along with the detailed explanation to help you to understand the key concepts. Certified Professional Coder, that is CPC exam, evaluates the proficiency in medical coding through 100 multiple choice questions covering 17 key knowledge areas. So in my tutorial series, I will take all 17 topics in a different video and will explain the key concepts within them. The majority of questions present the real world coding scenario designed to assess the accurate application of CPT procedure codes, HCPCS Level I procedures and supply codes, as well as ICD-10-CM diagnosis code. In this model paper 1, the first chapter is medical terminology. It consists of 4 questions. These questions assess your knowledge of medical terminology for all systems in the human body. Okay, let's start the first question. Chapter 1, medical terminology. There are 4 questions. Question number 1. In rhinoplasty, A. Nose is reconstructed. B. The brow is reconstructed. C. The lips are reconstructed. D. The chin is reconstructed. So please pause the video for a few seconds and think the answer.
5, 4, 3, 2, 1.
Yeah. The prefix rhino or rhine means nose. It comes from the Greek word rhis, which is also means nose. For example, rhinorrhea, that is an excessive discharge of mucus from the nose, also known as a runny nose. So the suffix plasty means surgical repair or reconstruction. So the rhinoplasty is a surgical procedure to repair the nose. So in the rhinoplasty, the nose is reconstructed. So the answer is A. The second question, the mediastinum is A. A location in the chest bounded by the sternum, diaphragm and lungs. B. A small endocrine organ behind the heart. C. A part of the lymphatic system. D. Both the heart and lungs. So pause the video for a few seconds and think
3,
the answer.
2, 1.
Let's go for the answer. So actually the mediastinum is the space between the right and left lungs is called the mediastinum. You can see in the picture the number 16. This is the mediastinum, you can see. It contains the heart, aorta, esophagus and bronchi. So for the second question, the correct answer is A. Let's go for the medical terminology. Third question. Which one of these medical terms describe a severe body-wide response to an infection? A. Bacteremia. B. Sepsis. C. Edema. D. Erythema. So please pause the video for a few seconds and think for the answer.
4, 3, 2, 1.
So in this question, see carefully, it says severe body-wide response to infection. So in this question, the bacteremia refers to the presence of bacteria in the bloodstream. But septicemia or sepsis means severe bacterial infection of the tissues that spreads to the blood, also called sepsis or blood poisoning. In septicemia, bacteria and their endotoxins cause severe systemic symptoms. So the questions ask severe body-wide response to an infection. So the answer is B. Here you can see edema. So edema means abnormal accumulation of fluid within tissue spaces as a result of systemic disease or failure of the lymphatic system to drain tissue fluid from the side. That is edema. For more knowledge, erythema means the redness of the skin caused by swelling of the capillaries. So you can see this is the normal food. This is edema. It's swelled, and this is and also pitting edema. These things are for your extra knowledge. For the question, the answer is sepsis. Let's go for the fourth question of medical terminology. The anatomical plane dividing the body into superior and inferior portions is sagittal plane, coronal plane, transverse plane, frontal plane. So let's pause the video and think the answer.
3, 2, 1.
So let's see what are the planes. You can see the sagittal plane. Sagittal plane divides the body into right and left halves. The coronal plane, that is divide the body into frontal and backwise half. Transverse plane is divide the body into half. That is, head is one side and bottom part is other side. Like that, you can see mid sagittal plane. That is a middle line go through your body, and the upper part is called superior, lower part is called inferior, and the front part is called anterior, back part is called posterior. Also, the part middle to the sagittal line is called medial, and away from that mid-sagittal line is called lateral. Here the question is the anatomical plan dividing the body into superior and inferior portion. That is called transverse plan. So answer is C. Okay, these are the questions. There are 4 questions in medical terminology. So please subscribe my channel and stay with us for the other questions of other chapters. Model paper 1, second video. In this video, we will see the anatomy questions. There are 4 anatomy questions. These questions will assess your knowledge of anatomy and all body systems of the human body. Model paper 1, chapter 2, anatomy, 4 questions. So the first question is, the lunula is a part of which of the following structures? A. Skin, B. Nail, C. Thyroid, D. Ear. So please pause the video for a few seconds and think the answer.
5, 4, 3, 2, 1.
Yeah, if you know the anatomy, this question will be very easy for you. So the lunula is the part of the nail. You can see the number 4 here. This part is the lunula. So this is the half moon shaped area at the base of the nail. The lunula, this is number 4, is a region where new growth occurs. The lunula has a whitish appearance because vascular tissue underneath does not show through. So you can see this is the lunula. Same thing you can see in the side view. This part is the lunula where the nail growth occurs. So the answer is B. Question number 2. A patient presents with an injury to the great saphenous vein. Which anatomical region is likely affected? A. Neck, B. Arm, C. Leg, D. Abdomen. So pause the video for a few seconds and think the answer.
5, 4, 3, 2, 1.
Yeah, if you know the anatomy of the venous system, this question will be easy for you. So if you take the heart, the venous systems are draining in the blood into the heart. So if you see, the main draining vessels are vena cavas, that is superior vena cava on the top and the inferior vena cava from the bottom. So if you take the inferior vena cava, go down, you can see it's divided into 2 main veins, that is common iliac vein. So in the hip region, this vein is divided into 2 veins, the right side and left side, common iliac veins. In the common iliac vein, in the thigh region, divided into the main femoral vein and the great saphenous vein. You can see femoral vein. This one is femoral vein and this one is the great saphenous vein. Again, the femoral vein in the knee region divided into 2. You can see one is the small saphenous vein, other one is tibial vein. Again, the tibial vein divided into anterior and posterior, like this, it's go down. So the great saphenous vein or the saphenous vein is belong to the leg. So in this question, the answer is C. Let's go to the third question. An umbilical hernia protrudes from which of the following body areas? A. The inguinal space in the groin area. B. The esophageal space in the abdomen. C. The belly button. D. The testis. So please pause the video for a few seconds and think the answer.
5, 4, 3, 2, 1.
Okay, if you know the umbilical hernia is in the umbilical region, so you can exclude this B, that is esophagus, so it's not correct answer. And the 3 other answers are inguinal space, belly button, the testis. So you can remove this testis as well. So A and C are the probable answer. So let's see how the hernias occur in our body. You can see there are 5 main hernias there. So the hernia means it's a protrusion of any organ, tissue or structure through the wall of the cavity in which it is naturally contained. For example, inguinal hernia, that is occur in the inguinal or groin region, develops in the groin where the abdominal folds of flesh meet the thighs. Strangulated hernia, that is not the separate hernia. Once the inguinal hernia or other hernia develop into the necrosis or gangrene, it is called the strangulated hernia. When the hernia becomes tight, the tissue part will be damaged or necrosed. That is called the strangulated hernia. The umbilical hernia, you can see number 3 here. The umbilical hernia is a protrusion of the part of the intestine at the navel or belly button. Other hernias are diaphragmatic hernia and hiatal hernia, where this diaphragmatic hernia normally occur as a congenital disorder, and a hiatal hernia in which the lower part of the esophagus and the top of the stomach slide through an opening that is called hiatus in the diaphragm into the thorax. So for this question, you don't need much knowledge because straight away you can answer the umbilical hernia is C, the belly button. But this additional knowledge on hernia is very important to face the main questions. So in this question, the correct answer is C, that is the umbilical hernia protrudes through the belly button. Question number 4. Which of the following has a refraction function in the eye? A. Macula, B. Retina, C. Lens, D. Iris. So please pause the video for a few seconds and think the answer.
3, 2, 1.
So if your mother tongue is not English, you may be confused what is meant by refraction. So I'll show you here. The refraction is when the rays of light come into your eye parts converge the light rays to the retina to display the image. So this convergence, this path change occur due to some structures in the eye. So the refractive media of the eye are transparent structures that allow light to pass through and focus on the retina. So the cornea is the main part that make refraction, make the 70% of refraction. The second one is the lens, other 20 to 30% refraction done by the lens, and the aqueous humor, the fluid in the front chamber, and the vitreous humor, that is fluid in the backside, or that this fluid maintain the globe of the eye. These two also helps the refractory function. So main refractory parts are cornea, that belong to 70%, and the lens is belong to 20 to 30%. So in this question, the answer is C. Model paper 1, chapter 3, compliance and regulatory. This section will test your knowledge on compliance and regulations which pertain to cover the services covered under Medicare Part A, B, C and D, applying according to payment policy, place of service reporting, fraud and abuse, also NCCI edits, NCDs, LCDs, HIPAA, ABNs and RVUs. Chapter 3, Compliance and Regulatory. 3 questions. Question number 1. Which entity offers compliance program guidance to form the basis of a voluntary compliance program for a provider practice? A. Center for Medicare and Medicaid Services, that is CMS. B. American Medical Association, that is AMA. Office for Inspector General, OIG. Office for Civil Rights, OCR. So please pause the video for a few seconds and think the answer.
5, 4, 3, 2, 1.
If you are preparing for AAPC CPC certification, you have to know all 4 these entities and their functions. So if you take the Centers for Medicare and Medicaid Services, that is CMS, it provides coverage for people over the age of 65, blind or disabled individuals, and people with permanent kidney failure or end-stage renal disease. Same as AMA, American Medical Association, is a professional organization representing physicians and medical students, advocating for their interest and promoting public health. It works to improve the art and science of medicine through policy advocacy, education, research, and physician support. Also, CPT code book is a registered trademark of the American Medical Association and its largest single source of income. If you see the OIG, that is Office of Inspector General, is engaged in activities to test the efficiency and economy of government programs to include investigation of suspected healthcare fraud or abuse. The Office of Inspector General, OIG, has provided compliance program guidance. This guidance can be used to form the basis of a voluntary compliance program for a physician practice. So if you read the question, which entity offer compliance program guidance to form the basis of voluntary compliance program for the provider practice? So it is obviously the Office of Inspector General. So for additional knowledge, what is OCR, Office for Civil Rights? The U.S. Department of Human and Health Services Office for Civil Rights, that is OCR, enforces federal civil rights laws, conscience and religious freedom laws, HIPAA privacy, security and breach notification rules, and Patient Safety Act. OCR's primary function is to ensure equal access to opportunity for individuals in HHS funded programs and services. OCR also investigates and resolves complaints of discrimination, ensures compliance and civil rights laws, and promotes fairness and equity. So for this question, the correct answer is C. but you have to know the all four entities and their functions. Question number 2. The full description of CPT code 24925 is, so there are 4 answers. Please pause the video and look into your CPT code book and answer this question.
5, 4, 3, 2, 1.
In the CPD book, there are 2 types of description. One is common, other one is unique. The common portion of the description follows the code and end with semicolon. You can see this one, 24900. You can see amputation arm through humerus and is followed by semicolon. So this part is common for all other items that are coming underneath. So any CPT that share that description is intended beneath the code. Any portion of the description following the semicolon is the unique portion of the descriptor and only belongs to the single code. For example, for this 24900, this with primary closure is belong to this one. 920 open and circular belongs to this one. Like that is go. In the case of code 24900 contains common description, that is amputation arm through humerus, and codes 24920 through 24931 share the part of the description and so are intended beneath it with their unique portion of the description beside them. So the answer is C, that is amputation arm through humerus, secondary closure or scar revision. Question number 3 of chapter 3. Which one of the following is a commercial or private payer? A. Blue Cross Blue Shield. B. Medicare. C. Medicaid. D. Veterans Health Administration, that is VHA. So please pause the video for a few seconds and think the answer.
3, 2, 1.
You already know that there are government and private or commercial payers. So if you take government payers, there are main 2 payers are available, Medicare and Medicaid. The Medicare is the most significant government insurer. Medicare is a federal health insurance program administered by the Centers for Medicare and Medicaid Services. Second one is Medicaid. Medicaid is a health insurance assistance program for some low-income people, especially children and pregnant women, sponsored by the federal and state governments. Similarly, Children's Health Insurance Programs, that is CHIP, provides health coverage for children. Additionally, the Veterans Health Administration, that is VHA, and TRICARE for military personnel and their families are also government-funded healthcare programs. So if you take the private or commercial payers, so other than these 4, you can consider other payers as the commercial payers. The commercial payers, also known as the private health insurance companies, are the major source of health coverage in US, covering approximately 67% of the population. Most renowned companies are Blue Cross Blue Shield, United Healthcare, United Health Fund, Aetna, Humana, Golden Rule. So there are so many private payers are available. For this question, you can get the answer A, that is Blue Cross Blue Shield. Model paper 1, chapter 4, coding guidelines. This consists of 7 questions. This section will address the ICD-10 coding guidelines for coding and reporting, CPT coding guidelines, and the parenthetical notes and modifiers used. Model paper 1, chapter 4, coding guidelines. There are 7 questions. Question number 1. According to the repair, that is closure, CPT guidelines, what type of repair is reported when a single layer closure include copious irrigation and extensive cleaning to remove particulate matter? A. Simple repair. B. Complex repair. C. Intermediate repair. D. Simple repair plus code for irrigation. So please pause the video for a few seconds and find the answer.
3, 2, 1.
Okay, these questions you have to read the coding guidelines of the repair or closure. So take your CPT code book, go to the index, go for the repair, and find the place and read the repair notes. So if you go to the repair page, there are definitions for simple repair, intermediate repair, and complex repair. If you read the simple repair definition, that says primarily epidermis or dermis or subcutaneous tissue repair requires simple one layer closure. So simple repair means epidermis, dermis, or subcutaneous tissue and requires simple one layer closure. Hemostasis and local or topical anesthesia when performed are not reported separately. So this is simple closure. If you read the definition for the intermediate repair, it says deeper layers of subcutaneous tissue and superficial, that is non-muscle fascia, in addition to the skin, that is epidermis or dermal. So intermediate repair is deeper part. So beyond the skin, you can repair the subcutaneous tissue and the superficial muscle fascia as well. And also it says single layer closure of heavily contaminated wounds that have required extensive cleaning or removal of particulate matter also constitute intermediate repair. So if we done any single layer closure with contaminated wounds that require extensive cleaning or removal of particulate matter also included in the intermediate repair. So the question is, what type of repair reported when a single layer closure includes copious irrigation and extensive cleaning to remove particulate matter? So the answer is the intermediate repair. So the answer is C. So for further knowledge, when you see the complex repair, in addition to the requirements for the intermediate repair, require at least one of the following: exposure of bone, cartilage, tendon, or named neurovascular structure, debridement of wound edges. Very deep structure only, it categorized as complex repair. In each exam, there will be one question regarding modifier. So let's see the common question regarding modifier. Modifier 59 is typically used to indicate a separate procedure performed on the same day, B, a distinct service unrelated to the primary procedure, C, an unusually complex procedure, D, an incomplete procedure. So please pause the video and find the answer.
3, 2, 1.
Okay, so if you need to find the answer regarding modifiers, you can get the summary of modifiers in the hard front page of the CPT book. When you see this modifiers summary, you can see modifier 59 say distinct procedural service. But if you need to verify more detail regarding this, you have to go to the appendix A of the CPT book. So when you go to the appendix A of the CPT book, you can see 59 distinct procedural service. Here, under certain circumstances, it may be necessary to indicate that a procedure or service was distinct or independent from other non-ES services performed on the same day. So this regard, you can see the modifier 59 typically used to indicate a distinct service unrelated to the primary procedure. That is the correct answer is B. Okay, question number 3. In which of the following scenarios does a diabetes related complication exist, but the diabetes code is not sequenced as the primary diagnosis? Answer A, a patient has hyperglycemia that is not responding to medication. Answer B, a patient experiences an underdose of insulin due to an insulin pump malfunction. C, a patient is being treated for secondary diabetes. D, a patient is being treated for type 2 diabetes. So please pause the video for a few seconds and find the answer.
3, 2, 1.
To answer this type of questions, you have to be thorough with the coding guidelines for each category of topics. In this scenario, patient present with the diabetes related complication, but diabetes code is not sequenced as the primary diagnosis. So you can eliminate the answer C and D. You can, if you read carefully both answers, C is a patient is being treated for secondary diabetes. So if it is a primary or secondary diabetes, the diabetes code should be sequenced as a primary diagnosis. D also, a patient is treated for type 2 diabetes. In the medical record, if it is mentioned as just diabetes or type 2 diabetes, it should be considered as a type 2 diabetes. So here also it is directly sequenced as the diabetes code. Similarly, if you read the answer a patient has hyperglycemia and that is not responding to medication. So here the first diagnosis hyperglycemia. Hyperglycemia itself, it is diabetes. So all three answers you can eliminate. So you can go for the answer B. The answer B says a patient experiences an underdose of insulin due to an insulin pump malfunction. So if you read the ICD-10 CM coding guidelines 1C, 4A, 5A, the number 5 says complications due to insulin pump malfunction, that is underdose of insulin due to insulin pump failure. An underdose of insulin due to an insulin pump failure should be assigned to a code from subcategory T85.6 as the principal of first listed code. So this T85.6 is a mechanical complication of other internal and external prosthetic devices, implants and grafts. Also, that specifies the type of pump malfunction. So the pump malfunction is sequenced as the primary code, not the diabetes code. For this question, the answer is B. Question number 4. A cardiologist attempts a percutaneous transluminal coronary angioplasty, that is PTCA, on a totally occluded vessel but terminates the procedure due to high risk anatomical constraints that prevent the safe catheterization. Which modifier should be appended to the PTCA procedure code? A 52, B 53, C 54, D 76. Please pause the video and go to the modifier summary and find the answer.
3, 2, 1.
Okay, in this case, the main word is terminates the procedure. So here, the cardiologist terminates the procedure due to some issues. Modifier 52 means reduce services. Modifier 53 means discontinue procedure. Modifier 54 means surgical care only. Modifier 76 means repeat procedure or service by the same physician or other healthcare professional. So in this case, the cardiologist terminates the procedure. So that is modifier 53, that is discontinued procedure. So the answer is B. Question number 5. Which statement regarding lesion excision is true? So there are 4 answers. So please pause the video and find the answer.
3, 2, 1.
So in this question, it is asking for the definition of the lesion excision. Here you go to your CPD book of index and go to the excision and find the excision nodes. So when you find the excision nodes, there are 2 types of excisions. One is benign lesion, other one is malignant lesion. So if you read the definition for excision of benign lesion is defined as full thickness through the dermis, removal of a lesion, including margins, and includes simple non-layered closure when performed. So this is the definition of excision of benign lesions. Similarly, the malignant lesion also the same definition is applicable. That is, excision is defined as full thickness through the dermis, removal of a lesion, including margins, and includes simple non-layered closure when performed. So both are having same definition. So in this case, which statement regarding lesion excision is true? So here the answer is A, that is, lesion excision codes include removal of a lesion with margins and simple non-layered closure when performed. So the exact definition is mentioned in answer A. So the answer A is correct. Other answers are wrong. You can read those answers. Question number 6. An orthopedic provider treats a closed scaphoid wrist fracture with initial fracture care, including application of a short arm cast. The patient will return for follow-up management. According to CPD guidelines for casting and fracture care, how should this encounter be reported? So there are 4 codes available. Pause the video and go to your CPT code book and find the answer.
3, 2, 1.
So these type of questions, finding the code in ICD-CM or CPD, there are 2 ways. In the real world scenario, you had to identify the main term or main procedure. In the CPD book, go to the index and find the code and check in the tabular list. Similarly, ICD-10CM also. But in the exam case scenario, you can find the answer within short period. So you can use the elimination method. Elimination method is you can use the answers in the MCQ, directly go to the answer. So here you can use the answers provided in the MCQ and straight away you can go for the code book. For here you can see the answers having 25 series and 29 series. So you can directly go to that code and you can find the answer easily for the purpose of MCQ. But in the real world scenario, you can have to find the main term and go to the index and find the answer. So I will explain the both ways to find the answer. So in this question, you can see the orthopedic provider, the main term is closed scaphoid wrist fracture with initial fracture care. And other term is casting and fracture care. So there's casting and the fracture care. So let's go and straight away check the answers of MCQ type. So go for the 25.6.22. So if you read that 25.6.22, it says close treatment of scaphoid, that is navicular fracture, without manipulation. But this code does not say about the casting. So let's go the 29.0 and 75. So that is here. It says elbow to finger, that is application cast, semicolon. So semicolon means after the semicolon you have to read other answers as well. So application cast, elbow to finger. So that is short arm. Here you can see closed scuffide wrist fracture with initial fracture care. So wrist fracture included in the elbow to finger. So in between the elbow to finger, there's wrist. So this code is exact. This code is exactly describe the scenario. The interesting part of this question is answer C, that do we need to combine both the codes? The first code is close treatment of carpal scuffide fracture without manipulation, and second code is application of cast, elbow to finger. So do we need to combine these two codes? Means this, for this case scenario, that is not needed, because the orthopedic provider treats a closed scuffide wrist fracture with initial fracture care. So this is initial fracture care, including application of short arm cast. So as this is the initial fracture care, no need to add this code additional to the elbow to finger casting. So the answer should be B, that is single code application of cast, elbow to finger. So this is the easiest way to find the answer for this MCQ type question. So if you encounter this similar scenario in your coding practice, you don't have this four answers. So in that scenario, you had to find the answer from the index. So in this scenario, the main term is casting or cast. So in the CPT index, go for the index of cast and you can find the answer. So when you go into the CPT index, you can see cast. In the cast, you can go down and you can see elbow to finger. So the wrist is in between the elbow to finger. So you can find the code here. So once you go back to the code, again you can read elbow to finger, that is short arm. So you can see. So here you can see application cast, that is elbow to finger. So this is the direct way of finding the answer. Okay, let's go to the final question of this coding guidelines. That is the seventh question. A 42-year-old patient presents with a localized sternal chest pain that worsens with palpitation. After evaluation, including EKG and cardiac biomarkers, the physician rules out angina and documents a diagnosis of probable costochondritis. Which ICD-10-CM code should be assigned for this encounter? So you can see the answers. Please pause the video and take your ICD-10-CM code book and find the answer.
3, 2, 1.
Okay, in this scenario, the main terms are sternal chest pain and the rules out the angina and diagnosis of probable costochondritis. So here you have to know the angina is not a diagnosis. Similarly, this costochondritis is also a probable diagnosis, not the confirmed diagnosis. So in this scenario, if the diagnosis is not confirmed, you can code with the symptoms. So here the symptom is sternal chest pain. You can see the sternal chest pain is the symptom. So that should be the diagnosis code. Okay, so for this MCQ, you can use the elimination method. So you can find the answer by using these answers given in the ABCD. So you can see A R07.9 and similarly the C answer also R0.7.89 and others are two different answers. So in such a scenario, you first go to the answer that is used frequently. So here in this scenario, the R07 is used frequently. So first go to that code and check the code. Okay, if you go to the code R07.9, that is this one, it says chest pain unspecified. But if you go for the answer C, R07.89, that is this answer, other chest pain, anterior chest wall pain, not otherwise specified. So here in this case, the chest pain is the sternal chest pain. The sternum is the anterior part, so that is the anterior chest pain. So this code R07.89 explains the chest pain, that is anterior chest pain, not otherwise specified, because there's no diagnosis of angina, there's no confirmed diagnosis of costochondritis. So in this case, we have to go for the symptomatic diagnosis, that is sternal chest pain. So sternal chest pain is the anterior chest wall pain. So the correct answer is R07.89, that is answer C. So this is the elimination method to use in the MCQs. So if you use the same scenario in the real world, so you have to go to the ICD-10-CM alphabetic index. There you have to go for the pain, chest and ward. So it will refer you to R0789. Again, you go to that code in the tabular list, you have to verify the code. So this is how you can find the answer in the real world. Model paper 1, chapter 5. ICD-10 coding. This section will consist of 5 questions. This section will test your proficiency in diagnosis coding within the chapters of ICD-10 as well as through the knowledge of ICD-10 official guidelines for coding and reporting. Additionally, diagnosis questions will appear other sections of the exam from the CPT categories as well. Question number 1. A patient is diagnosed with diabetic polyneuropathy. According to ICD-10 coding guidelines, which codes should be reported? Here 4 codes are given. So please pause the video for a few seconds and take your ICD-10 code book and find the answer.
3, 2, 1.
So let's see the answer. In this case, you can see E10 code, E11 code and G62 code. There are 3 codes used. So for this MCQ, you can directly go for the elimination method to find the answer. So in this question, the patient having diabetic polyneuropathy. If any diabetic patient, the type 1 or type 2 is not mentioned, by default you have to take it as the type 2 diabetes mellitus. That is the rule 1. If mentioned as diabetes, it is equal to type 2 diabetes mellitus. So let's see the codes. E1042, that is type 1 diabetes mellitus with diabetic polyneuropathy. E1142 code is type 2 diabetic mellitus with diabetic polyneuropathy. E109, type 1 diabetes mellitus without complication. E119, type 2 diabetes mellitus without complication. So here you have to decide the answer whether it's 1042 or 1142. 1042 is type 1, 1142 is type 2. So in this scenario, the type 1 or type 2 is not mentioned, but by default you have to take it as type 2 diabetes mellitus. So the correct answer is D, that is E1142. In the real working scenario, you have to find the answer by going to the ICD-10 index. So go to the index, go for diabetes, then go for type 2. There you will find polyneuropathy. It will indicate the code E1142. Then you have to go back to the tabular list and confirm the diagnosis. So again, you will find the correct answer is D. Question number 2. A patient presents for an intercostal nerve block to manage severe pain due to metastatic cancer to his lungs. According to ICD-10 guidelines, which codes accurately represent this scenario? So there are 4 answers. So please pause the video, take your ICD-10 code book and find the answer.
3, 2, 1.
So for this question, you can find the answer in 2 ways. One way, you can go to the alphabetic index of the ICD-10 code book and you can find the answer, but it is time consuming. For this MCQ, you can use the elimination method. So you can see there are only 3 codes: G89 code series, C34 code series and C78. So you can check those 3 codes and you can find the answer. So in this question, the patient came to the clinic for severe pain due to the metastatic cancer. So the reason for this encounter is pain management. Pain in neoplastic is the first listed diagnosis. So let's go and check the G89 codes. So G8912 is acute post-thoracotomy pain. So that is not related to our case. So G89.3 is neoplasm related pain, acute or chronic. So that is the first diagnosis of our case. So you can eliminate other A and D. So those are not suitable. So now you have to select the answer from B and C. So let's check the C codes. So when you check the C3491 is malignant neoplasm of unspecific part of right bronchus or lung. 92 is malignant neoplasm of unspecific part of left bronchus or lung. But C7801 is secondary malignant neoplasm of right lung. C7802 is secondary malignant neoplasm of left lung. Here, there's no site is mentioned, but it says metastatic cancer to his lungs. His lungs is plural, mean there are right and left involved. So you can select this C78 as the diagnosis codes. So for this question, the answer is C. That is G89.3, C78.01 and C78.02. So if you go for the real world scenario, you have to go to the index. So in the index, first you have to find the code for the pain. So here, go to the alphabetic index, go to pain, There you have to find due to malignancy, primary or secondary. It will lead you to G89.3. You have to go back and check the tabular list. Likewise, the metastatic cancer, you have to look in the table of neoplasms for neoplasm, then go to neoplastic lung and use the code from the malignant secondary column because the cancer is metastatized to his lungs, making it secondary. So it will lead you to the C78 code. So in the tabular list, there's no code for bilateral. So both the right and left lung are reported separately. Question number 3. Mr. Pereira had polyps removed on a previous colonoscopy. The patient returns 3 months later for a follow-up examination for another colonoscopy. No new polyps are seen. What diagnosis coding is reported for the second colonoscopy? So please pause the video and take your ICD-10 code book and find the answer.
3, 2, 1.
Okay, in this scenario also, we can use the elimination method to find the answer. So here you can see there are 3 codes, Z09, Z86 and K63.5. So let's check the answers. So before going to the answer in the questions, there are 3 things you have to note. First thing is polyps removed on a previous colonoscopy. Second thing, now the patient came for the follow-up examination. In the follow-up examination, there's no new polyps. So when you check the Z09 code, it says the encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm. So these polyps are not malignant neoplasm. So we can use the Z09 code. So in this case, we can eliminate B and C answers. So only A and D available. So here we can check the K code, K63 and Z86. The K63.5 says polyp of colon and Z86.01 says personal history of benign neoplasm and 86.010 says personal history of colonic polyps. So this is a tricky part of the question.
Question number 4. What ICD-10-CM code is reported for a patient who is a habitual abuser of cannabis? So there are 4 codes available. So please pause the video, take your ICD-10-CM code book and find the answer.
3, 2, 1.
Okay, in this case scenario, you can see all 4 answers. All 4 answers are based on F12 code. So you can directly go to the F12 code and find the answer. So when you go there, you can check all the codes. F12 129 is cannabis abuse without intoxication. Here the patient is habitual abuser of cannabis. It didn't say any dependence or any complication or nothing told there. So you can omit this answer. F12 159, that is cannabis abuse with psychotic disorder, unspecified. So psychotic disorder not mentioned in this case, so you can omit this answer. C, F12.10, that is cannabis abuse uncomplicated. So you can take this answer. Again, D, F12 121, that is cannabis abuse with intoxication. So the intoxication or the psychotic disorder not mentioned here. So the answer will be C, that is F1210, cannabis abuse uncomplicated. But in the real world scenario, you have to go for the alphabetic index of the ICD-10 code and you have to find the answer. So if you want to find the answer directly from the alphabetic index, go to the index and look for abuse, drugs, cannabis. So go for abuse, then go down to drugs, then go for cannabis. It's guiding you to the subcategory code F1210. So then you have to go back to the tabular list and have to verify it. So the answer is C. Question number 5. A patient with hypertensive heart disease is now experiencing accelerated hypertension due to papillary muscle dysfunction. What ICD-10 codes are reported? So please pause the video, take your ICD-10-CM code book and find the answer.
3, 2, 1.
Okay, in this scenario, there are 3 codes used, I11, I10 and I51 codes. So you can use the elimination method to find the answer quickly. Okay, so let's see the question. It says hypertensive heart disease, accelerated hypertension due to papillary muscle dysfunction. So let's see each code. Code number I119 is saying hypertensive heart disease without heart failure. I10 says essential, that is primary hypertension. I11 I already said. I5189 says other ill-defined heart diseases. See official guidelines, hypertension with heart disease like this. And answer D says I10 and I5189. So it's a complex answer. How to find the definitive answer here? So here you have to use the ICD-10-CM guideline. So in the guideline says section 1C9A1 heart conditions. So as per the ICD-10-CM guideline says section 1C9A1 heart conditions, that I52, I51.4, I51.9 are assigned from category I11. When a causal relationship is stated due to hypertension or implied hypertensive, the same heart conditions with hypertension but without a stated causal relationship are coded separately. So in this scenario, we can code only the I11-9, that is hypertensive heart disease without heart failure. So the answer is A. So if you are using the alphabetic index to find the answer, go for hypertension due to heart disease and it will lead you to I11.9. So this will be the only code to report since there's a causal relationship between the hypertension and the heart disease. Now you can verify it in the tabular list as well.
Section number 6, HCPCS Level II. It consists of 3 questions. This section will evaluate your knowledge on HCPCS Level II coding and include the questions focusing on modifiers, supplies, medications, and professional services for Medicare patients. Question number 1. A patient received 500 mg of ceftriaxone sodium intravenously prior to surgery. Which HPCS code accurately reports this medication? So there are 4 J codes available. So please pause the video for a few seconds, take your HPCS Level 2 code book and find the answer.
3, 2, 1.
Okay. In this case, the dosage is 500 mg, the drug is ceftriaxone sodium, and the route of administration is intravenous. So you can see all the answers are J codes. There should be answer within these 3. Maybe there's outlier, one answer is there. So you can directly go for the code and check. Go to the J codes area and find the answer. So in the J code, you can see J015 is injection ceftriaxone. This is ceftriaxone. So you have to read carefully. Don't confuse with the letters. J0696 is injection ceftriaxone sodium. So that is the drug we have used here. So the dosage is 250 mg. Here we have used 500 mg. So the code is J0696, but that is half a dosage. So if you give the same dosage, you have to multiply this 250 into 2. So the answer should be J0696 into 2. If you see this 697 code, that is injection sterile cefuroxime sodium. So these antibiotic name is slightly different with each other. So we have to be careful when reading the antibiotic name. So the correct answer is C, that is J0696 into 2. So in the real world scenario, so if you want to find the answer without this MCQ answers, you have to go to the index. So in the index, you have to go to the ceftriaxone sodium. You can see there are similar names of antibiotics are there. You have to be careful with the name. Ceftriaxone sodium. So it will indicate J0692. So when you go to the code, it will say injection ceftriaxone sodium for 250 mg. So if it is 500, you have to multiply it by 2. So that is what we got the answer, J0696 into 2. Question number 2. Which of the following HCPCS Level 2 code ranges is specifically designated for reporting durable medical equipment? For example, a wheelchair. So there are 4 answers: G codes, K codes, L code, and S codes. So please pause the video for a few seconds and take your HCPCS Level 2 code book and find the answer.
3, 2, 1.
So in this question, here it mentions durable medical equipment, like for example, wheelchair. So here you can find the answer by straightforward. So if you go to the second page of the HCPCS code book, it gives the tabular list. It will list out the codes ranges for which area these codes are used. So for example, if you can see G codes, that is here, that is for procedural or professional services. K codes, you can see K codes here, that is durable medical equipment. So that is the exact answer, K code. If you see L codes, orthopedic procedure and services, S codes, you can see temporary national code. So for this question, the answer is B, that is K codes. It's a straightforward one. Question number 3. A patient required ambulance transport for a non-emergency situation. The services rendered were at the basic life support level. What is the correct HCPCS Level II code for this transport? So there are 4 answers with A code. So please pause the video for a few seconds, take your HCPCS code book and find the answer.
3, 2, 1.
Yeah, in this question, you have to know this is ambulance transport and also non-emergency, also basic life support. So these 3 things are very important: ambulance transport, non-emergency, basic life support. And you can see the answers, all answers are A04 codes. So A04, 27, 29, 33, 34. You can directly go to those A codes and find the answer. A0427, ambulance service, advanced life support. But here it is basic life support. So this is not suitable. A0428, ambulance service, basic life support, non-emergency transport. So all 3 situations are making ambulance transport, non-emergency situation, basic life support. So the correct answer is A0428. If you check the other answers, 429, ambulance service, basic life support, this is emergency transport. But here, our one is non-emergency situation. 433, advanced life support. But our one is basic life support. 434 is specialty care transport. So in this case, the correct answer is B. In the real world scenario, if you want to find the answer directly, you have to go to the index. There you have to search for the ambulance. So if you go for ambulance, it will say ambulance and other transport services and supplies. So here you can see advanced life support. So you have to search for the basic life support. So when you go there, you will find basic life support here. So there are 2 codes. So when you go to the code tabular list, you can see 428 and 429. 428 is non-emergency transport. 429 is emergency transport. So in our case, is it 428, non-emergency transport. So the correct answer is B. Model paper 1 CPT series questions. This CPT series consists of 6 code series, that is 10,000, 20,000, 30,000, 40,000, 50,000 and 60,000 code series. So in this video, we'll see the 10,000 code series. It consists of 6 questions. The 10,000 series of CPD codes related to the surgical procedures performed on the intergumentary system, which include the skin, subcutaneous tissues, and accessory structures, as well as nails, pilonidal cysts, repairs, destruction, and breasts. 10,000 series codes. Question number 1. A patient required a full thickness skin graft to the forearm, with the size of the graft being 20 square centimeters. Which of the following CPT codes should be used? There are 4 codes of 10,000 series. So please pause the video for a few seconds, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight full thickness skin graft of the forearm. The size is 20 square centimeter. So you can see 4 answers: 15,000, 100, 101, 240, 260. So you can find the answer by elimination method. So you can directly go to the answers. So if you go to the answer 15,100, split thickness autograft, trunk, arms, legs, first 100 square centimeter. But in our case, this is full thickness skin graft. So this code not suitable. So this is the additional code. So both are not correct answers. So if you see what is the full thickness and split thickness, in the split thickness skin graft, epidermis and partial dermis is used. But in the full thickness skin graft, epidermis and dermis is used. So let's see the other answer. 15,240, full thickness graft free, including direct closure of donor side, forehead, cheeks, chin, mouth, neck, axilla, genitalia, hands, 20 square centimeter or less. So in our case, full thickness skin graft, forearm, 20 square centimeter. So the answer is 15,240. So here you have to note, if it is 20 square centimeter, this code is for 20 centimeter or less. So if it is 20, the code we have to use this one. If it is 21, you have to use additional code. So if it is 21 square centimeter, you have to use 15,240 plus 15,241. Like that you have to use. So in this case, the answer is C. If you encounter same case in a real world scenario, you have to use the index of the CPT book. So go to the alphabetic index. There you can go for skin, then go for graphs. There it will lead you to the free codes 1552 1551 range, or else 15200 to 15261 range. So you have to go to the tabular list and you have to find the answer, or else you can search the answer another way. Go to graft, then skin. In the skin it will lead you to the skin graft and flap, or skin substitute, or skin substitute graft. So again you have to go to the tabular list and find the answer. Both way you will find the answer is C. Question number 2. An incision in drainage IND is performed on a subcutaneous abscess located on the upper arm of a 4-year-old child. Following the procedure, pus is expressed and a dry gauze dressing is applied. What is the appropriate CPT code for this IND? So there are 4 codes of 10,000 series and 20,000 series available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
So in this question, you have to highlight that this is an incision and drainage. So in this case, the pus is drained. So there are no sutures done here. So the performed on a subcutaneous abscess. So one abscess IND done on the upper arm and the 4-year-old child. The following the procedure, pus expressed, dry gauze dressing applied. There's no suture involved. So you can see the answers are 10,000 series and one is outlier, that is 2,000 series. So you can use the elimination method to find the answer. So you can directly go to the codes and check the codes with the case. So if you check the 10,060, that says incision and drainage of abscess. There are types of abscess are marked in the bracket, and it is simple and single. So in this case, it says abscess. So it's a single procedure and the simple procedure. So it is shoots the case. If you take the 61, that is complicated or multiple. So straight away you can go to the answer A. So let's check the other answers as well. So if you check the answer 1080, that is incision and drainage, complex post-operative wound infection. So this is not the scenario. If you take 23930, incision and drainage, upper arm or elbow area, deep abscess or hematoma. Here it is deep abscess, but in our case it's a subcutaneous abscess. So the correct answer is A, that is 10,060. So this is the MCQ method. So if you deal the case in a real working scenario, you have to go with the alphabetic index. So go to the CPT alphabetic index. There go for the incision and drainage, and again select the abscess, then skin. So in the skin, it will refer you to 10,060 to 61 code series. So again go to the tabular list and find the correct answer, that is A. Question number 3. An 11-year-old female patient has 2 dark lesions and a skin tag on her back. 2 punch biopsies are performed on the lesions located on her right upper back. Additionally, the skin tag on her back is removed using electrocauterization. What are the appropriate CPT codes to report these procedures? So there are 11,000 code series are used here. So please pause the video for a few seconds, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight the following things. One is age, 11 years. There are 2 dark lesions and 1 skin tag. So the 2 dark lesions are punch biopsied, that is on the right upper back, and the skin tag is removed using electrocauterization. Okay, when you see the answers, the 11,100 series and 11,200 is used. So you can use the elimination method to find the answer. So you can directly go to the codes and check. So when you go to the 1104 code, it says punch biopsy of skin, including simple closure when performed, single lesion. So 1104 is used for single lesion, but here we have removed 2 lesions. So for additional each separate lesion, what is 1105 we had to use. So this should be listed separately. So there are 2 lesions, so you have to code 1104 and 1105. So in this scenario, you can remove this A. It says 1104 only. B also 1104 into 2. That is not suitable. The C also not suitable. So the answer D is 1104 and 1105. So that is for the skin lesion. If you check the skin tags, that is 11-200, you can see removal of skin tags, multiple fibrocutaneous tags, any area, up and including 11 lesions. So up to 11 lesions, you can use 11-200. So here only one lesion, so you can use 11-200. But there are two procedures you have performed. One is the punch biopsy, other one is the removal of skin tags. So you have to use the modifier 59. So there are two separate procedures. So indicate that you have to use the modifier 59. So the answer is D. If you using the case in the real working scenario, you have to use the alphabetic index. So in the alphabetic index, you have to go for the lesion, then go for skin, then go for biopsy or punch. So it will lead to the codes 104 and 105. So you can go back to the tabular list and check the answer. Similarly, for the skin tags, you have to go to the skin, again tags, or then removal. So you'll be referred to 11-200 to 11-201. Again, go back to the tabular list and confirm the answer. Again, you will find the answer is D. Question number 4. A 24-year-old woman found, question number 4. A 24-year-old woman found a lump in her right breast during a routine examination. She had a mammogram which confirmed the lump and then met with the surgeon for a needle biopsy without imaging. What code would you use for this procedure? So there are 4 10,000 series codes. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, there are a few things we have to highlight. First one is lump in her right breast. Second one is needle biopsy without imaging is done. So those two things are very important. So let's check the code. So here you can see the check codes are 19,085 and 86, 100 and 101. So the very close codes are available here. So you can directly go to the codes and you can find the answer by elimination method. So when you go to the code 19085, it says biopsy breast including magnetic resonance guidance. Here we are using without any imaging. So this says MRI guidance. So this answer is not suitable. So second answer 86 is additional lesion. Here one lesion is biopsied. So both answers are not possible. So let's try other codes. So 1900, it says biopsy of breast percutaneous needle core not using imaging guidance. So this is the correct answer. When you see the 101, it is open and incisional. But here we use needle biopsy. So the correct answer is C. So in the real working scenario, if you use the same case, so you have to find the answer using the alphabetic index. So when you go to the CPT and alphabetic index, go for the skin, there go for biopsy and breast. It will lead you 1900 and 1901. Again, you have to go back to the tabular list and find the answer. Question number 5. A 3-year-old child sustained burns after pulling a pot of hot water from the stove. Examination revealed first-degree burns covering approximately 3% of total body surface area on the lower face and second-degree burns covering approximately 11% of total body area on both arms. The facial burn was treated with the Silvadene dressing. The second-degree burns on the both arms showed no sign of infection and had intact blisters. These were cleansed and also treated with Silvadene dressings. The procedures and diagnosis codes are as. So here both the CPD and ICD-10 codes are provided. So please pause the video, take your CPT and ICD-TM code books and find the answer.
3, 2, 1.
Okay, in this case, you have to note there are 2 types of burns occurred due to the hot water. The first one is first degree burn, that is 3% on the lower face. Second one is second degree burn, 11% on both arms. And both the burns are treated with the Silvadene dressing. So this is the situation. So let's find the answer. So you can see the CPT codes are similar codes and also ICD-10 codes are similar codes. So let's find the CPT code first. So shall we use the elimination method? Let's go to the 60,000, 25, 20 and 30 codes. So the 20 codes says dressings or debridement of partial thickness burn, initial or subsequent, small, less than 15% body surface area. Partial thickness burn is second degree burn. So in our case, the 3% face burn is the first degree. So this code is not suitable because it says the partial thickness, that is second degree burn. So let's take 16030, that is large, more than one extremity, greater than 10% of body surface area. So this is the one mentioned in the second one, that second degree burn, 11% in both hands. So here it's large, more than one extremity, more than 10%. So this is suitable. So 16030 is suitable, but 16025 is not suitable. So you can omit the answers A and C. So you can keep the answer B and D. So both the 16030 is available. So let's check the code for the first degree burn. So when you go to the 16,000, it says initial treatment first degree burn when no more than local treatment is required. So that is the scenario here. There's only the silverine dressing, no silverine dressing. That is large, more than 10%. But here the more than 10% is the second degree burn. But this is talking about the first degree burn. So this is not suitable. 16025 is medium, that is 5 to 10%. But here our one is the small. So the correct answer is 16,000. And 59 is the modifier for the separate procedure. So there are two procedures, one for the face, other one for the extremities. So the correct answer is D. So you can select the correct answer as D using the CPT codes itself. So no need for the ICD term. So you can find the answer directly for the directly with the CPT codes. But for the knowledge, you can check the ICD-10-CM codes as well. So in the ICD-10-CM, you can see T22.2 is burns of second degree of shoulder and upper limb except wrist and hand, unspecified size. So here our second degree burn is both hands, 11%. So that is suitable for the answer D. Also the second one, T20.10, that is burn of first degree of head, face and neck, unspecified side. Here you can see first degree burn of face. So that is suit for the second scenario. And the third scenario is the external cause of the burn, that is X12, that says contact with hot fluids. According to the ICD-10-CM guidelines, sequence fetch the code with highest degree of burn in the case of multiple burn. In the ICD-10-CM alphabetic index, you will find the second degree burn as the T22.2. In the tabular list, T22.2 requires 7 character. A is reported to indicate this is an initial encounter. One dummy placeholder X is required for the 6th character to keep the 7th character in the 7th position. Again, the ICD-10-CM alphabetic index look for burn head first degree, that is T20.10. In the tabular list, T20.10 requires 7 character. So A is reported to indicate this is the initial encounter. One dummy character X is required for the 6th character to keep the 7th character in the 7th position. In the ICD-10-CM external cause to injuries, index and look for burning hot water, and you are directed to seek contact with hot tap water. For contact with hot water, X12 in the tabular list, they include the term X12 is reported to contact with water heated in stove. A 7 character is required. 7th character A is reported for the initial encounter. Dummy placeholder X are used to keep the 7th character in the 7th position. So the location, activity, and the external cause status are not stated and are therefore not reported. The physician performed the excision of two 1.5 centimeter malignant lesions on a patient's upper back. During the surgery, the physician noted 4 additional lesions which looks to be pre-malignant. These lesion excisions were 0.3, 0.7, 1 and 1.4 centimeters respectively. The suspected lesions were sent to the pathology lab where they were determined to be benign. What are the appropriate codes for the service? So there are 11,000 series codes are there. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here we have to note the excision of two 1.5 centimeter malignant lesion, that is on the upper back. Also the lesion excision, another 4 lesions, those are benign. Okay, so altogether 6 lesions, 2 malignant and 4 benign lesions. So here you can see the answer 11,400, 401, 402. So there are nearby codes used. So you can use the elimination method to find the answer. So straight away we can go to the codes. So when you go to the 11,400 series code, it says excision, benign lesion, including margins. So benign lesions are excised. So in this case, you can see this 0.3, 0.7, 1 and 1.4 centimeters are benign. It was suspected as malignant, but the pathology report came as benign. So you have to code these 4 lesions as the benign codes. So let's see, you can see 0.3. So 0.3 is less than 0.5 centimeters. So you can use 11,400 and 0.7. 0.7 is in between to 0.6 to 1. So you can use 11,401. Again, 1 centimeter. 1 centimeter also including within that code range. So you can use 11,400 into 2 and 1.45. 1.45 falling into 11,402. So here you can see 11,400, 11,400 into 2 and 11,402. So this is clearly coded as the benign codes here. So let's check the code for the malignant lesion. So let's go to the 11,600. It says excision malignant lesion including margins, diameter 0.5 centimeter or less. But in this case, the 2 malignant lesions are 1.5 centimeter. So 1.5 centimeter falls within 11,602. You can see excess diameter 1.1 to 2 centimeter. So here you have to use, there are 2 lesions. So you can use 11,602 into 2. So you can see this answer is exactly represent the codes. So the correct answer is D.
The 20,000 series consists of surgical procedures performed in musculoskeletal system from head to toe. Especially these areas includes head, neck, back and flank, spine, abdomen, shoulder, arm, hand and fingers, pelvis and hip, leg, foot and toes.
20,000 code series. Question number 1. A physician performed the following trigger point injections. 2 injection into the flexor carpi muscle, 1 injection into the extensor carpi muscle, 3 injections into the triceps brachii, 1 injection into the biceps brachii. What is the correct code for these injections? So there are 20,000 code series are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is a trigger point injection. 2 injection, 1 injection, 3 injection, 1 injection. So 2, 3, 6, 7. So altogether 7 injections. So let's see how to code these injections. So when you see the answer, all are 20,500 and something. So 553 and 52 are there. So you can use the elimination method to find the answer quickly. So let's go to the code directly. So if you go to the code 20,552 and 53, you can see 552 is injection single or multiple trigger points, 1 or 2 muscles. Here 1 or 2 muscles. The 553 is single or multiple trigger points, 3 or more muscles. So this code itself coding for 3 or more muscles. And also the explanation says here, do not report 20552, 2553 in conjunction with 560, 560 for the same muscles. For imaging guidelines performed, other codes are used. So in this case, there are 7 injections, but this code itself says 3 or more muscles. So you no need to code separately for the additional muscles. This code itself says 553 is 3 or more muscles. So you can directly find the answer, that is B. So this answer itself code for the all 7 injections we have given. So if you're using this case in a real working scenario, you have to go with the alphabetic index. When you go to the alphabetic index, go to the injections, there you will find trigger points. So there it will say 1 or 2 muscles, 20552, 3 or more muscles, 20553. Then go back to the tabular list, then you can confirm the answer. Question number 2. A patient suffered a comminuted fracture of the right arm due to a crush injury. The physician implanted 3 pins in a single plane above the fracture and 2 pins and 1 wire along the same plane under the fracture location on the humerus of the right arm. What is the correct code for this service? There are 20,000 codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, the fracture is comminuted fracture, and you can see the above there are pins inserted and below also pins inserted, but all are inserted in the same plan. This is very important part. The wire along with the same plan. So you can see the answers 20,690, 962 and 690, 692. Those codes are available. So you can use the elimination method to find the answer quickly. So let's go to the 2690 code. So before that, you have to understand what is the single plan or multiple plans. So when you see if there's any comminuted fracture, it can be fixed using a external fixation. Here you can see it's a single plan, only one plan. We have inserted the pins. But in this case here you can see that there are different plans. They have inserted the pins. So in this case, it is a same plan or the single plan, right? When you see the code 2690, it says application of a unique plan, that is a single plan, pins or wires in one plan, unilateral external fixation system. So in this case, you can see we have inserted the pins and wires in a same plan. But this code doesn't mention what are the number of pins or what are the number of wires. So any number of pins or wires, if it is used in a single plan, unilateral external fixation, the code 2690 can be used. If you see the adjacent code 692, it says application of the multi-plan pins and wires. And 693 says adjustment or revision of external fixation. 694 says removal under anesthesia. So there's no additional notes to mentioning the number of pins or wires. So in this case, the code is 2690. That is one code for unique plan external fixation, irrelevant to the number of pins we have used. So the correct answer is A. So if you use the same question in a real working scenario, you have to go with the alphabetic index. So in the alphabetic index, go for the external fixation device. There you can see application, then go for external fixation. They are multi-plan and unique unit plan. So this unit plan, that is 2690, is the code. So you can check with the tabular list. So in that scenario also, you can find the answer A easily. Question number 3. A patient with a torn medial meniscus underwent an arthroscopic diagnostic procedure via the anterolateral portal. During the arthroscopy, grade 2 chondromalacia was observed on the patellar aspect of the patellofemoral joint and was subsequently debridated using a 4 mm shaver. The medial compartment was then accessed, revealing a complex posterior horn tear of the medial meniscus, which was probed to delineate its extent. A meniscectomy was performed, removing the torn portion back to a stable rib. Which CPT codes accurately represent the services provided? So there are 20,000 code series are available. So please pause the video for a few seconds, take your CPT code book and find the answer.
3, 2, 1.
So this is a tricky question. There are two procedures. Actually, the procedure started as the diagnostic arthroscopy, but ultimately it went into the meniscectomy. So here we have to highlight torn medial meniscus, arthroscopic diagnostic procedure. There we have found grade 2 chondromalacia. For that, debrided using a 4 mm shaver. The medial compartment, there was a complex posterior horn tear of the medial meniscus. So it was probed to delineate its extent. A meniscectomy was performed. So here the surgeon started this case as the diagnostic procedure as arthroscopy, then ended up with meniscectomy. So here if you see the codes 29,880, 81 and 79. So there are adjacent 3 codes available. So don't waste your time with the index. Directly you can go to the elimination method and directly go to the code. So when you go to the code 879, 880 and 881. So 879 says abrasion arthroplasty includes chondroplasty where necessary or multiple drilling or microfracture. 880 that continues with the 79 that says with meniscectomy, medial and lateral, including any meniscal shaving, including debridement or shaving of articular cartilage. 881 says with meniscectomy, medial or lateral, and the same description there. So with 880 and 881, the difference is 880 is medial and lateral, but 881 says medial or lateral. So in this scenario, you can see the case is started as the arthroscopic diagnostic procedure. So you can see arthroscopic diagnostic procedure and ended up with meniscectomy. So meniscectomy is in the posterior compartment. When you read this, revealing a complex posterior horn tear of the medial meniscus, which was probed to delineate its extent. A meniscectomy was performed so in the medial meniscus. So you can see medial or lateral. So in this case, there's no two parts, medial and lateral, but in this case, it's using only the medial or lateral. So that is medial. So the 29881 is suitable. So in this case, you can the correct answer will be 29881 because the tear was in the medial meniscus and a meniscectomy was performed. Shaving and debridement of the patellofemoral joint is included in the primary procedure as indicated by the code descriptor, even so there were different compartments of the knee. The surgery has started out as a diagnostic procedure, but that changed when the physician decided to perform the surgical procedures on the knee, rather than only examining the knee for the diagnostic purpose. So in this case, the 29881 is correctly mentioned the procedure. So the answer is D. So if you're using the alphabetic index, that is the real world scenario, you can go for the arthroscopy. Then the arthroscopy change into surgical procedure, not only diagnostic. So you can go to the surgical. There you have to go for the knee. So in the knee is indicate the code series. Again, go back to the tabular list. There you can confirm the correct answer is 29881. That is the answer D. So this is a tricky question. One or two tricky questions may appear in your real exam, not the whole questions. So you don't panic or don't worry about this type of questions. There are 2 or 3 questions will be available like this. So be ready for the worst scenarios also. So you can easily do your exam. One day following an upper leg surgery, a 45-year-old male patient presents with serious drainage from the surgical site. He is taken back to the operating room for exploration due to a suspected hematoma. Upon exploration, a hematoma is found at the base of the wound. This hematoma is carefully evacuated and the wound is irrigated with antibacterial solution. Which CPT and ICD-10-CM codes should be reported for this encounter? So there are both CPT and ICD-10-CM codes are available. So please pause the video for a few seconds, take your CPT and ICD-10-CM code books and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is a follow-up leg surgery. So one day after following up the leg surgery, patient developed hematoma, then hematoma is evacuated, irrigated with an antibacterial solution. The surgery done on the upper leg. So these are the things you have to note. So when you see the codes, you can see 10,142 codes are there and 27,603 and 301 codes are there. So here you can use the elimination method to find the answer. So let's go directly to the code on the CPT code book. Okay. When you go to the CPT code book, 10,140 is incision and drainage of hematoma, seroma or fluid collection. So in this case, it doesn't mention any site or any place. If it is so, we have to take it as the superficial hematoma IND, that is incision and drainage. If you go to the code 27301, that is incision and drainage, deep abscess, bursa or hematoma, thigh or knee region. So you can see in the bracket it says for incision and drainage of abscess hematoma superficial, see 10,042, 10,160. So this one is in the superficial region. Here it says incision, IND, hematoma, thigh or knee region. So here you can see the case is upper leg. Upper leg means above knee. So that is thigh. So this code is suitable, 27301. If you see the code 27603, that is incision and drainage, leg or ankle, deep abscess, hematoma. Here the site is leg or ankle. But in our case, it is upper leg. So this code is not suitable. So in this case, this 27301 code is the suitable one. So you can see all the four answers, one having that code, that is 27301. So you can omit all other three answers and you can get the answer D before you are checking the ICD-10 CM code. So the correct answer is D. But here you can see there is a modifier used. 78, 79, 76 are used. The previous day patient undergone the surgery, but the next day the patient admitted due to the complication of the surgery. So this is an unplanned return. When you see the modifier 76 is the repeat procedure, but 77 is repeat procedure by another physician. Modifier 78 is unplanned return to operating or procedure room. So this is the modifier you had to use 78 because this is the unplanned return to the operating room. If you say 79, that is unrelated procedure, but this is related procedure but unplanned return. So the modifier 78 is needed. So if you want to check the ICD-10 code, you can see the M96.840, that is post-procedural hematoma of the musculoskeletal structure following a musculoskeletal system procedure. So post-procedural hematoma. So that also describing clearly the condition. So this is the elimination method to find the answer. But if you are working in a real world scenario, you have to check with the index of the CPT and ICD-10 code. So if you go to the CPT code book index, go to hematoma, there you have to go to leg and upper. So it will refer you to the 27301. When you go to the ICD-10 code, you have to go to the hematoma post-operative, that is post-procedural. You are directed to see the complication post-procedural hematoma by site. So it will ask you to look for complication post-procedural hematoma musculoskeletal structure following musculoskeletal surgery. It will lead you to M96.840. Then you have to go about the tabular list and need to verify. Type of questions may be given in the exam with the CPT and ICD-10 code. So most of the time you can find the answer with the CPT code itself and you have to verify the ICD-10 code, finalize the answer. Question number 5. A physician took an impression of a 47-year-old woman's left orbital socket and created a custom prosthesis. What is the correct code for this service? So there are 4 20,000 series codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, this question is a straightforward one. Here you can see left orbital socket, a prosthesis is implanted. So you can see the answer 21,076, 77, 88 and 89. So you can use the elimination method to find the answer. So you can directly go to the codes. So the code 21076 says impression and custom preparation, surgical obturator prosthesis. 21077, that is orbital prosthesis. 21088 is facial prosthesis. 21089 is unlisted maxillofacial prosthetic procedure. So in this case, it is clearly says left orbital socket prosthesis. So this is the orbital prosthesis. So you have to code this 21077, and also this is left side. So you have to put the modifier LT to indicate the left side. So the correct answer is B. If you encounter this case in a real working scenario, you have to go to the CPT index. There you have to go for the prosthesis, then go for orbital. It will redirect you to the 21077. Then you have to go to the tabular list and check. Or else you can directly find the index orbital prosthesis. So you can directly find the code 21077. Again, you can go to the tabular list and check. Okay, let's move into the 6th question. A 37-year-old woman notices a lump in her left lower abdominal wall. A large 6 cm tumor was found on the CT scan along the musculature of the abdominal wall. This was removed and found to be a desmoid tumor. What is the code for this procedure? So there are 22,000 series codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
This is also a straightforward question. So here you have to notice tumor size is 6 centimeter. Also the tumor is the desmoid tumor. So this is an intramuscular tumor. When you check the code, 22900 is excision tumor soft tissue of abdominal wall, that is subfacial, example intramuscular, less than 5 centimeter. So in our case, the tumor is 6 centimeter. So the next code is 5 centimeter or greater. So the suitable code is 22901. If you check other codes, 22902, that is excision tumor soft tissue of abdominal wall, subcutaneous. This says subcutaneous, but our case is intramuscular, so that is desmoid tumor. So these two codes are not suitable. In this case, the tumor size is more than 5 centimeter. So the correct answer is 22901. That is answer B. So if you use the case in a real working scenario, you have to go to the CPT index book. There you have to go for the index of excision, then tumor, then abdomen. Then it will redirect you to the 22900 to 904 code series. So you have to go to the tabular list and find the answer. So the correct answer will be B. AAPC CPC Model Paper Chapter number 9. This chapter includes the CPD code series of 30,000 code. The 30,000 series of CPD codes focuses on the surgical procedures performed in the respiratory system, the cardiovascular system, the hemanic and lymphatic system, and the mediastinum and the diaphragm. 30,000 series codes. Question number 1. A patient in cardiac arrest had to be intubated with an endotracheal tube during advanced cardiac life support treatment. What procedure code would you use for this emergency ET tube intubation? So there are 31,000 series codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
In this question, it's a straightforward one. There is a emergency endotracheal tube intubation. So when you see the codes, 31,000, 420, 500, 502, and then 505. So these all three codes are nearby codes. So you can guess the answer should be within these three codes. So you can use the elimination method to find the answer. So let's directly go to the code. Okay, when you go to the code 31420, it says epiglotticectomy. So that is not suitable here. 31500, it is intubation endotracheal emergency procedure. So that is exactly describe the procedure. So the answer should be intubation endotracheal and emergency procedure. So other answers you can see 502 tracheostomy tube, 505 laryngoscopy tube. So the correct answer is B. So if you encounter the situation in the real working scenario, you have to use the alphabetic index. So go to the CPT box alphabetic index. There you can search for intubation. Then you can find the sub-index endotracheal tube. It leads you to 31,500. You can go back and check the tabular list. Similarly, there is a direct code. When you go to the endotracheal intubation, you can see emergency 31,500 or endotracheal tube emergency intubation 31,500. So by using index also, you can directly find the answer. Question number 2. A 50-year-old patient with stage 3 non-Hodgkin's lymphoma underwent a surgical procedure to obtain a biopsy of enlarged cervical lymph nodes identified on a PET scan. Enlarging lymph nodes 3 to 3.5 centimeter were identified deep to the ligated external jugular vein following an incision in the supraclavicular region and dissection through the platysma muscle. One of these nodes were excised after sequential clipping of its hilar vessels. Which CPT code best describes this surgical excision of deep cervical lymph node? So there are 4 CPT codes from 20,000 and 30,000. So please pause the video for a few seconds, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case you have to highlight this is stage 3 non-Hodgkin lymphoma and biopsy of enlarged cervical lymph nodes done. So here the biopsy, one of these nodes, not all, only one of these nodes were excised after sequential clipping of its hilar vessels. So here you can see 21,550, other codes are 35,720, 510 and 520. So you can use the elimination method to find the answer. So you can go directly to the codes. So you can guess that this 21,550 is an outlier. So this 38,000 are most probable answers. So once you check the codes, 21,550 is biopsy soft tissue of neck or thorax. 38,720 is cervical lymphadenopathy complete. But in this case, only one lymph node is removed for biopsy purpose. So that is not suitable here. So 38,500 is a biopsy or excision of lymph nodes, open superficial. 510 is open deep cervical node. 520 is open deep cervical node with excision, scalene fed pain. Here, one of these nodes was excised after sequential clipping of hilar vessels. So there's no muscle or fat pad removal. So the correct code is 38510. That is open deep cervical nodes. So the correct answer is C. So if you encounter this case in a real working scenario, you have to go with the index. So once you go to the alphabetic index, go to the biopsy, then go down to lymph nodes, again go down to open. Once you go there, it will suggest following 6 codes. Again, you have to go back to the tabular list and you have to verify the codes. So once you verify, you will find the correct answer is C, that is 38,510. Question number 3. A patient with a history of deep vein thrombosis is prescribed a vena cava filter. The physician inserts the filter via a femoral vein approach with ultrasound guidance. What is the appropriate CPT code? There are 37,000 code series available. So please pause the video for a few seconds, take your CPT code book and find the answer.
3, 2, 1.
So here you have to highlight this is a deep vein thrombosis. Here prescribed vena cava filter that was inserted through femoral vein approach with ultrasound guidance. When you see the answers, all answers are adjacent answers. So you can use the elimination method to find the answer. So go directly to the codes. So when you go to the code, the 37191 is insertion of intravascular vena cava filter, endovascular approach, including vascular access, vessel selection, and radiological supervision and interpretation, interprocedural road mapping, and imaging guidance. That is ultrasound and fluoroscopy when performed. So here you can see the deep vein thrombosis inside the femoral vein approach. The femoral vein approach is the endovascular approach. So that is correctly described the procedure. So the correct answer should be 37,191. If you see other answers like 37,192, that says about repositioning of the intravascular vena cava filter. That is the repositioning of already inserted intravascular vena cava filter. So that is not suitable. So the correct answer is A, that is 37,191. If you check the other answers, 37,193, it says about a retrieval, that is removal of the intravascular vena cava filter. So that is not suitable. 37,195 is thrombolysis, cerebral by intravenous infusion. So that is not relevant to this case. So again, the answer is 37,191. If you encounter this case in a real working scenario, you have to find the answer using the CPT alphabetic index. So in the CPT alphabetic index, you have to go to the vena cava filter. Again, you will find the subcategory of insertion. So that will lead you to the code 37,191. Again, you go back to the tabular list and confirm the answer. So the answer will be A. Question number 4. A 3-year-old boy presented to the pediatrician's office after the patient's mother discovered that the boy had inserted a jelly bean into his nose. The mother, when trying to remove the jelly bean, ended up pushing the bean further into the patient's nose to the point that it is no longer visible. Upon presentation, the patient was extremely agitated and anxious and was experiencing pain and swelling in the left nasal sinus. The pediatrician determined that due to the patient's emotional state and the depth of the jelly bean, the patient would have to be anesthetized to remove it. The pediatrician admitted the patient into the hospital and performed the removal of the foreign body under general anesthesia. At one point, a lateral rhinostomy was considered but ruled out. The physician was finally able to grasp the foreign body. How should we code the CPT code for this service? So there are CPT codes available. So please pause the video for a few seconds, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to note that the patient initially admitted or visited to the pediatrician's office. After that, the pediatrician assessed the patient and decided to go for the foreign body removal under anesthesia. So there are two scenarios. One, the patient encountered in the pediatrician office. Then the patient have been admitted to the hospital and foreign body removed under anesthesia. So when you see the codes, you can see there are two codes used in the answer. One is 99 series, that 9921-4 and 99392. Other code is 3310 and 3320. So let's use the elimination method to find the answer. So let's go to the 99 series. So here you can see the 9924 says office or other outpatient visit for the evaluation and management of an established patient which requires medically appropriate history or examination and moderate level of medical decision making. So that is the exact scenario here in the patient's encounter. If you see other answer 99392, that is a continuation of the 99391, that is periodic comprehensive preventive medicine. So that is not relevant to this case. So you can omit that answer. So here you can use 99214 as the first code. So this is for the evaluation and the management part. When you see the 3310, that is the removal of foreign body. Here 3310 is requiring general anesthesia, and 3320 is by lateral rhinostomy. But here in this case, the lateral rhinostomy is considered but not done. Here you can see at one point the lateral rhinostomy was considered but ruled out. So that is not done. So as it is not done, the suitable code here is 3310. So 99214 and 3310 is the suitable code. So here the two encounters happen. One, the patient admitted to the pediatrician office, then patient admitted to the hospital. So the modifier 57 has to be added. The modifier 57 is decision for surgery, that is an evaluation and management service that resulted in an initial decision to perform the surgery may be identified by adding modifier 57 to the appropriate. So the correct answer is A. So if you encounter this case in a real working scenario, you have to find the answer using the index of the CPD book. So when you use the index of CPD books for the initial encounter in the pediatrician office, you have to go to the CPD index and go to the evaluation and management services. Then you have to go to the office or other outpatient visit. Then you have to find the established patient. There are 99211 to 99215 code series. So go back to the tabular list and you have to find the answer. For the second part, go to the removal of the foreign body. Again, you can find the code removal foreign body intranasal office type procedure, and 3310 requiring general anesthesia. So this 3310 is the suitable code. So the answer is A. Question number 5. A physician performed a resection of the diaphragm utilizing an autogenous free muscle flap. What is the correct CPT code? So there are 39,000 code series are there. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight that this is the resection of diaphragm and also the repair done using autogenous free muscle flap. So when you see the codes, all codes are adjacent codes, 39,000, 540, 541, 60, 61. So you can use the elimination method to find the answer. So directly go to the codes. So when you go to the codes, 39540 is repair diaphragmatic hernia. But here this is not the repair, this is resection of the diaphragm. So this is not suitable. 39541, that is chronic, so both answers are not suitable. When you see 39560, resection diaphragm with simple repair. Example, primary suture. That is 560. 561 says with complex repair. Complex repair means prosthetic material, local muscle flap. So in this case, you can see autogenous free muscle flap. That is autogenous means this local muscle. So the answer should be 39561. So the correct answer is D. If you encounter this case in a real working scenario, you have to use the index of the CPT code. So go to the CPT code index, go to resection. In that you have to go to the diaphragm. It will lead you to the codes 39560 and 61. Again, go back to the tabular list and confirm the answer. So the answer is D. Question number 6 of 30,000 series codes. A cardiovascular surgeon implanted a temporary pacemaker system in a patient with cardiac arrhythmia. The implanted system contained transvenous dual-chamber pacing electrodes. What is the correct code for the procedure? So there are 33,000 series codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Question you have to highlight, this is a temporary pacemaker and the transvenous dual chamber pacing electrodes. So if you want to know what is the difference with the temporary pacemaker and the implanted pacemaker, normally the temporary pacemakers are fixed outside. So you can see here, this is the external temporary pacemaker, that is generator box, and it go inside the body through the pacemaker lead in the subclavian vein. That's through the subclavian vein, it go to the right atrium and the lead go into the right ventricle. Here you can see the temporary pacemaker lead. For the right ventricle, it's generate the electric pulse. You can see the implanted pacemaker. You can see the pacemaker implanted under the skin. You can see by surgery, the pacemaker is inserted under the skin. It's generating the pulse. You can see the pacemaker lead is go through the subclavian vein to the right atrium to the right ventricle. Here you can see the pacemaker lead. It generates the pulse and heart pumps. So this is how the temporary and the implanted pacemakers are fixed. So you can use the elimination method to find the answer very quickly. So directly go to the codes. Okay, when you go to the code, you can see the 33,210 code is insertion or replacement of temporary transvenous single chamber cardiac electrode. But this is temporary, but the transvenous dual chamber pacing electrodes. But 210 is only the single chamber cardiac electrode. So that is not suitable. When you see the other answer, 33,211, insertion or replacement of temporary transvenous dual chamber pacing electrodes. Separate procedure. So this is the suitable answer. If you check other answers, 2016, that says insertion of single transvenous electrode, permanent pacemaker. But here it is temporary. So this is not suitable. 2017 also insertion of two transvenous electrodes but permanent pacemaker. So in our case, this is a temporary and dual chamber electrode. So that is 33,211 is the suitable answer. So answer B is correct. If you encounter this case scenario in a real working world, you have to go to the index of the CPT codebook. So go to the index, go to the pacemaker. There you have to go to the subcategory of pacemaker system with leads. Again, go to the insertion, then electrodes. There you will find the codes 33,202, 203, 210, and 211. Go back to the tabular list and you can find the answer. So the correct answer is B, that is 33,211. The 40,000 series of CPD codes of surgical procedure performed on the digestive system, which will focus on the areas of lips, mouth, palate, uvula, salivary gland and ducts, pharynx, adenoids, and tonsils and esophagus. Also stomach, intestine, appendix, rectum, anus, liver, biliary tract, pancreas, abdomen, peritoneum, and omentum. So let's see the questions. Question number 1. A newborn needs to have a cleft palate repaired. His cleft palate involves the soft and hard palates only. What CPT code would you use for the palatoplasty for this child? So there are 4 CPT codes given. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here you have to highlight this is a cleft palate repair. The soft and hard palates only repaired. So when you see the codes, the all codes are adjacent codes 42,200, 205, 210 and 215. So you can use the elimination method to find the answer. So directly go to the codes. Okay, when you go to the code 42,200, it says palatoplasty for cleft palate, soft and O hard palate only. So and O. So soft and hard palate only also included in this code. So this is the code that clearly mentioned the scenario here. That is cleft palate repaired, soft and hard palate only. So the correct code is 42,200. If you see other codes, 42,250, that is palatoplasty for cleft palate with closure of alveolar ridge, soft tissue only. But that is not the case. 2,210 with bone graft or alveolar ridge. That is not the case. 215 palatoplasty for cleft palate, major revision. But in our case, it's only soft and hard palate. So the correct code is 42,200. So the correct answer is A. If you encounter this scenario in a real working world, you have to go with the CPT index. So when you go to the CPT alphabetic index, go to repair, the subcategory cleft palate. It will lead you to the following code 200, 205, 210, 15, 20, 25. Again, you have to go back to the tabular list and confirm the code. So once you're done, Again, you will find the correct answer is A.
Question number 2. A 65-year-old male admitted to perform gastric banding. A laparoscope along with 4 to 6 trocar ports are sited through the anterior abdominal wall above the umbilicus. The silicone gastric band is placed and secured around the upper abdomen to form a smaller stomach pouch with a narrowed outlet. Tubing is attached to the band and tunneled through the abdominal wall connecting to an access port. What CPT code should be used for this procedure? So there are 4 CPT codes here. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here you have to highlight this is a gastric banding through laparoscopy. And also silicone gastric band is placed. So you can see the 4 CPT codes are 43,000 codes. So you can use the elimination method to find the answer. Okay, once you go to the codes directly, you can see 43,634. That is continuation of previous code. That is gastrectomy partial distal with formation of intestinal pouch. But this is not the case. When you see the 43,645, that is laparoscopy surgical gastric reconstructive procedure with gastric bypass and small intestine reconstruction to limit absorption. But this is not the case. But if you see the answer C, that is laparoscopy surgical gastric restrictive procedure, placement of adjustable gastric restrictive device such as gastric band and subcutaneous port components. So when you see the case, you can see it is a gastric banding through laparoscopy, silicone gastric band is placed. So that is the exact case we are encountering. So the correct answer should be 43,770. So the correct answer is C. So if you encounter this scenario in a real working world, you have to go with the index of the CPT code books. When you go to the alphabetic index, go to the laparoscopy. There you have to go to the subcategory of gastric reconstructive procedures. It will lead you to following codes. Then you have to go back to the tabular list and you have to find the correct code. So if you find the correct code, that will be the C, that is 43,770. Question number 3. A 4-year-old child received a gastric intubation from a physician after ingesting approximately 5 tablespoons of carpet cleaning detergent. The gastric tube was orally inserted through the esophagus and into the stomach, and lavage was performed to evacuate the stomach contents. What is the correct CPT code? So there are 43,000 series of codes available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case you can see this is the gastric intubation for ingesting carpet cleaning detergent. So what we have done is a lavage was performed to evacuate the stomach content. So this gastric intubation is for therapeutic purpose, not the diagnostic purpose. So you can see the codes, there are adjacent codes 752, 53, 54 and 55. So you can use the elimination method. So go to directly to the code and find the answer. So when you go to the codes, you can see 43752, that is naso or orogastric tube placement requiring physician skill and fluoroscopic guidance. So this is just for the tube placement. But in our case, we have to evacuate the gastric contents. So this is not suitable code. When you see the other code, 43753, that is gastric intubation and aspiration, that is therapeutic, necessitating physician's skill for gastrointestinal hemorrhage, including lavage if performed. So here in this physician have performed the lavage to remove the gastric content. So this 43753 is the suitable code. So the correct answer is B. If you see other codes like 43754, that is gastric intubation and aspiration diagnostic. But in our case, this is therapeutic purpose, not the diagnostic. 755 is collection of multiple fractional specimens, but that is not the case. So the correct answer is B, that is 43753. So if you encounter this case in a real working scenario, you have to go with the CPT index. So in the CPT alphabetic index, you have to go to the intubation, the subcategory gastric,
again there will be two category. One is therapeutic, other one is diagnostic. But in this case, this is therapeutic. So once you go to therapeutic, it will lead you to the code 43753. Then go back to the tabular list and confirm the answer. So the answer will be B.
Question number 4. A 48-year-old male has internal hemorrhoids and has elected to have them removed. The ligator and alligator forceps have been inserted through an anoscope. The physician identifies the most prominent hemorrhoid and ligates it at the base with the rubber band. Which CPT code should be used? So please pause the video for a few seconds, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is the internal hemorrhoids removal through an anoscope. The prominent hemorrhoid and it ligate with the base with the rubber band. When you see the answers, all answers are 46,000 series. There are 250, 55, 221 and 945. So you can use the elimination method to find the answer quickly. So let's go directly to the codes. When you go to the codes, 46250 is hemorrhoidectomy external 2 or more columns or groups. In this case, only one prominent hemorrhoid that was ligated with the rubber band. So this answer not suitable. The second one is 46255. That is hemorrhoidectomy internal and external single column. Here it says hemorrhoidectomy, but in our case, the hemorrhoids were ligated. The 46221 is hemorrhoidectomy internal by a rubber band ligation. So this is the correct answer. The rubber band ligation is used in the case. So the 46221, that answer C is suitable. When you see the other answer, 46945, it is hemorrhoidectomy internal by ligation other than rubber band. But here also the hemorrhoidectomy done by ligation, but that is other than the rubber band. But in our case, the rubber band is used. So the correct answer is C, that is 46,225. So if you encounter this case in a real working scenario, you have to find the answer using the CPT index. So go to the CPT alphabetic index. There you have to go to the hemorrhoidectomy. There you can go for the subcategory ligation. It will lead you to the code 46221. Again, you have to go back to the tabular list and confirm the answer. So answer will be 46221, that is C. Question number 5. A 45-year-old male admitted to the ward after a fall. He had 40 centimeter laceration on the anterior part of the tongue. He also has some other complexities, including lower lip contusion, due to which the physician suspects hematoma. The physician first completes the complex repair of tongue laceration and then performs an incision and drainage to address the hematoma on the lower lip. Which codes indicate the documentation for given process? So there are a couple of CPT codes for each answer. So let's pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, there are two procedures performed. So the patient had a 4 centimeter laceration, that is on the anterior part of the tongue, and lower lip contusions. So the physician suspect that contusion as the hematoma. So two procedures done. One is complex repair of the tongue laceration. Other one is incision and drainage to address the hematoma on the lower lip. So when you see the codes, there are two codes for two procedures. So all are 41,000 series. So you can use the elimination method to find the answer. So when you see the first procedure, that is complex repair of tongue laceration, you can see answers 41,252 and 41,100 and 41,800. So let's check the answers. So when you see the 41,252, that is repair of laceration of tongue, floor of mouth over 2.4 centimeter or complex. The other one is 41,100, that is biopsy of tongue anterior 2/3. So 41,100 is biopsy of tongue, so that is not suitable. 41,800 is drainage of abscess, cystohematoma from the dentoalveolar structure. But here is a 4 centimeter laceration repair. So you can use the code 41,252, that is repair of laceration over 2.6 centimeter or more. So our case is 4 centimeter. So this is the suitable code. So you can select A and C and you can omit other two, B and D you can omit. So for the second part of the question, there are two codes, 41,000 and 41,015. The 41,000 is intraoral incision and drainage of abscess, cyst or hematoma of tongue or floor of mouth, that is lingual. 41,015 is extraoral incision and drainage of abscess. So in this case, the hematoma is in the lip. So the lip is the intraoral part. So intraoral incision and drainage of abscess or hematoma is the suitable code. So 41,000 is the suitable code for the second procedure. So the correct answer should be C, that is 41,252 and 41,000 answers. If you encounter this case in a real working scenario, you had to use the CPT alphabetic index. For the first procedure, you had to go to the repair, then go to the laceration, then go to the tongue. It will redirect you to the following code, 41,250 and 41,252. Again, you had to go back to the tabular list and confirm the answer. The second procedure, that is incision and drainage of hematoma, you have to go to the alphabetic index, incision and drainage, the subcategory hematoma, then you have to go to the tongue. Even though it is a lip, you have to go to the tongue because this tongue part is including the floor of mouth also. So there it will lead to the code series. You have to go to the tabular list. It can confirm that the suitable code is 41,000. So the correct answer is C. Sixth question of the 40,000 series codes. A patient underwent esophagoduodenoscopy and had multiple biopsies taken of the esophagus, stomach, and duodenum. She also had one polyp removed with hot biopsy forceps from the antrum of the stomach. What CPT code should be used for this procedure? So there are 43,000 codes available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight two things. First thing is esophagoduodenoscopy and multiple biopsies taken from esophagus, stomach, and the duodenum. So one part is taken biopsy. The second part is one polyp removed with hot biopsy forceps from the antrum of the stomach. So there are two procedures done. So let's check how to code this. So you can see the codes are adjacent codes. The first code is 43,238. That answer is available in the all four answers. And additional codes are available 250, 251 and 255. So you can use the elimination method to find the answer. So let's go to the code directly, the 43,239 code. So the 43,239 is a continuation code of the 43,235. That code says esophagoduodenoscopy, flexible transoral diagnostic including collection of specimens by brushing or washing when performed. This is a separate procedure. In addition to that, 43,239 is with biopsy, single or multiple. So here multiple biopsy taken. So the 43,239 is 239 code should be coded here. So all four answers are having that code. But for answer A, only the 43,239 is available. But for the polyp removal of the antrum of stomach, this code does not include. So you have to check other answers as well. So other answers include 250, 251 and 255 codes. So let's check those codes. So when you check 250 code, it is a continuation of 235 code. That is esophagoduodenoscopy, flexible transoral with removal of tumors, polyps or other lesions by hot biopsy forceps. So this is the exact code to be used here because here you can see one polyp removed with hot biopsy forceps. That is coded by 43,250. If you check other answers, 43,251, that is with removal of tumors, polyps or other lesions by snare technique. But this is snare technique. But our one is hot biopsy forceps. So this is not suitable. Other answer 43,255 is with control of bleeding any method. But in our case, it is hot biopsy forceps method. So 43,250 is the suitable answer. For that, you can select the answer B. So the correct answer is B. If you encounter similar scenario in your real working world, so you have to use the CPT index. So in the CPT index box, you have to go to the esophagogastroduodenoscopy. For the biopsy, you have to go to the subcategory of biopsy. Then it will lead you to the code 43,239. For the removal of polyp, you have to go to the CPT index for removal. Then select polyp. In the polyp, you have to select the subcategory gastrointestinal upper. So gastrointestinal upper means that includes stomach, esophagus, those part. So it's lead you to the codes 43,250 and 251. So again, you have to go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer B. AAPC CPC Model Paper 1, Chapter 11. This includes CPD code series of 50,000. There are 6 questions will be tested. This will test your knowledge on surgical procedures performed on urinary system, the male reproductive system, the female reproductive system, including maternity and delivery, and the endocrine system. So let's see the questions. Question number 1. The patient presents to the gynecologist office complaining of stress incontinence. The gynecologist decide to perform a sling operation using synthetic materials to reinforce the patient's muscle and allow for additional urinary control. This procedure is performed laparoscopically in order to be less invasive. What is the correct code for this procedure? So you can see there are 57,000 and 51,000 codes are there. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Here you have to highlight this is stress incontinence, sling operation using synthetic material done through laparoscopically. So when you see the answer, 57,000 adjacent codes are there and 51,000 adjacent codes are there. So you can use the elimination method to find the answer. So directly go to the code and see. So when you go to the code 57,285, that is removal or revision of sling for stress incontinence. But here we are inserting. So for 57,288, that is sling operation for stress incontinence, fascia or synthetic. So that is the case here. So stress incontinence, sling operation using synthetic material. But keep in mind, this code does not say anything about the laparoscopic method. So this seems to be an open method. When you see the additional note here, you can see within bracket it says for laparoscopic approach, use 51,992. So very careful when you see the first answer, don't rush to put the code as B because this is open procedure. If you this procedure done laparoscopically, so the additional note says for laparoscopic approach use 51,992. So this code is continuation of the 51,990, that is laparoscopy surgical. You can see semicolon. So after the semicolon, you have to read this one. For the next code, you have to read this part before the semicolon. Then you have to read the other part. So 51,992 is laparoscopy surgical sling operation for stress incontinence, example fascia or synthetic. So the correct answer is D. So you can confuse with the answer B and D. So keep in mind you have to read the additional note below the code. It's very important. So if you encounter this case in a real working scenario, you have to go with the index of the CPT codebook. So when you go to the CPT alphabetic index, there you can directly go to the sling operation. There again you can go to the stress incontinence. Then it will lead you to 51,992. That is the laparoscopic method, and 57,285, that is open method. So you can check the code with the tabular list and finalize the answer. So once you finalize, the answer will be D. Question number 2. A 55-year-old female has a stricture of the left ureter with ileal conduit at the uretero-ileal anastomosis. She has had this chronic stricture and she receives scheduled stent changes on this side. She is here for her regularly scheduled stent change. What CPT and ICD-10 CM codes are reported? There are CPT and ICD-10 codes are available. Please pause the video, take your CPT and ICD-10 codes and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is stricture of the left ureter. That is a chronic ureter. Now the patient came for the scheduled stent changes. So she is here for regularly scheduled stent change. Okay, when you see the CPT codes, there are 50,000 codes and 52,000 codes are available. So those codes are adjacent codes. So you can first take the CPT code, use the elimination method, and you can narrow down the answers. Then you can go to the ICD-10 CM codes and find the correct answer. Okay, so let's go to the CPT codes. 50,688, that is change of ureterostomy tube or externally accessible ureteral stent via ileal conduit. So that is the correct scenario here. So if you see the other answers, 50,605,
That is ureterostomy for insertion of individual all time. And 52,332 cysto-ureteroscopy. That is not relevant here. So you can narrow down the answer to CPT codes 50,688. So you can omit the other answers that not having the code 50,688. So you can omit B and D. Now let's go to the ICD-10 CM codes. So when you see the ICD-10 CM N99.89, that is other post-procedural complications and disorders of genitourinary system. So that is not relevant here. And Z code Z43.6, that is encounter for attention to other artificial openings of urinary tract. So here this case is the ureterostomy. So encounter for attention to ureterostomy. So that code is suitable. So in this case, 50,688 CPT code and Z43.6 ICD-10 CM code is suitable. So the correct answer is C. So when you encounter this case in a real working scenario, you had to find the answer using the index of the ICD-10 CM and CPT. So once you go to the CPT alphabetic index, here you have to go to the ureterostomy stent changing. So ureterostomy stent, the subcategory change, then it will lead you to the code 50,688. Then you have to go back to the tabular list and confirm the answer. When you go to the ICD-10 CM alphabetic index, here you have to go with the attention to. So attention to the subcategory ureterostomy, it will lead you to the code Z49.6. Then you have to go back to the tabular list and confirm the answer. So correct answer is C. But here, according to the ICD-10 CM guidelines, Z codes are sequenced depending on the circumstance or problem being coded. Some Z codes are sequenced first to describe the reason for the encounter, while others are sequenced second. The aftercare codes are generally first listed to explain the specific reason for the encounter. So here in this case, the patient came for the aftercare, so the Z code should be coded as the first code in the ICD-10 CM coding. Question number 3. A physician performed a cytourethroscopy with an ejaculatory duct catheterization and irrigation. Duct radiography was also performed to visualize the ejaculatory duct system. What CPT code should be reported? So there are 52,000 and 74,000 codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here you have to highlight this is the cysto-urethroscopy with an ejaculatory duct catheterization and irrigation. Also duct radiography and visualize the ejaculatory duct system. You may be aware this is a test do in a male for infertility. So here you can see the first code are 52,000 and 52,010 and also 74,440 also available. So you can use the elimination method to find the answer. So directly go to the code. So when you go to the code 52,000, it says cysto-urethroscopy, that is separate procedure. 52,010 says cysto-urethroscopy with the ejaculatory duct catheterization with or without irrigation, insulation or duct radiography exclusive of radiologic service. So here this code is perfectly matching the scenario, that is cysto-urethroscopy with an ejaculatory duct catheterization and irrigation. Also when you see the 74,440 code, that is vasography, vesiculography or epidermography, that's a radiological supervision and interpretation. In this case, you have to know that vasography is a radiographic procedure used to evaluate the patency, that is openness of the vas deferens and ejaculatory ducts in males. So here in this question, it says ejaculatory duct system. It's not directly says the vasography, but the ejaculatory duct system visualization is called vasography. So in this case, 74,440 also additional code here. So the correct answer should be C. Okay, when you encounter this case in a real working scenario, you have to go to the CPT alphabetic index. There you have to go to the cysto-urethroscopy. Then go to the subcategory of ejaculatory duct catheterization. It will lead you to the code 52,010. Again, go back to the tabular list and confirm the answer. Similarly, go to the X-ray and go to the duct radiography. There it will lead you to 74,040. Again, come back and confirm the answer with the tabular list. Again, that will give the answer C. Question number 4. A VBAC is performed on a 30-year-old woman who received routine obstetric care for 9 office visits from physician A and postpartum care and delivery from physician B from a different practice. What is the correct CPT coding for physician B's service? So there are 59,000 code series are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight VBAC. VBAC is vaginal birth after cesarean section. Vaginal birth after cesarean section, that is in short form called VBAC. This VBAC is run after routine obstetric care of 9 office visits from a physician A and postpartum care and delivery from physician B from a different practice. Here you have to be very careful. The question is asking only for the physician B's service. You can see what is the correct CPT coding for physician B's service. So you no need to code for this previous obstetric visits of 9 office visits, those kind of things. You no need to code here. Here it is only asking for the physician B's service. Here you can see the answers are 59 series. So you can directly go for the elimination method and find the answer. So once you go to the answers, 59,610, that is routine obstetric care including antepartum care, vaginal delivery with or without episiotomy and postpartum care after previous cesarean delivery. 59,612 is vaginal delivery only after previous cesarean delivery with or without episiotomy and forceps. 59,614 is including postpartum care. So in this case, you can see the physician B, what he has done is postpartum care and delivery from the physician B. So in this case, you have to code 59,640, that is including postpartum care. This code is the continuation of the previous code. The previous code is vaginal delivery only after previous cesarean delivery including postpartum care. So the correct code is 59,614. If you see other codes like 49,425 antepartum care only 4 to 6 visits, 426 is 7 to 9 more visits. So this code is suitable for the physician A's service, but in this question it is not asking for the physician A's service, so no need to code this one. Also, if you see the other code 59,400, that is routine obstetric care including antepartum care, vaginal delivery and postpartum care. So that is not the case here. So here the physician B's service is vaginal delivery only after previous cesarean delivery including the postpartum care. So correct answer is B. So if you encounter this case in a real working world, you have to go with the CPT index. So if you go to the CPT alphabetic index, here you have to go for the postpartum care. In this postpartum care, you have to go for the subcategory vaginal delivery, that is 59,430. But in this vaginal delivery, this is after previous cesarean section delivery. So that is 59,614. Again, you have to go back to the tabular list and confirm the answer. So the correct answer is B. Question number 5. A patient with Bartholin's gland cyst present to the clinic for incision and drainage of the cyst. Due to the size and area of the cyst, the physician decides to incise the cyst and suture the lateral sides, leaving one side open for drainage. Which of the following codes would be represent the physician's work? So there are 56,000 and 53,000 codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you had to highlight this is Bartholin's gland cyst. And physician have done incise the cyst and suture the lateral sides, leaving the one side open for the drainage. So you can see the adjacent codes are available. So you can use the elimination method to find the answer. So directly go to the codes. When you go to the codes, 56,420 is incision and drainage of Bartholin's gland abscess. Here, but not only incision and drainage, there is also one side suturing. So if you go to the second code, that is 56,440, marsupialization of Bartholin's gland cyst. So in this case, you have to know what is marsupialization. If you know only, you can correctly answer this question. Because the marsupialization of Bartholin gland cyst is a surgical procedure where an opening is created in the cyst to allow for drainage and prevent future blockage. This is done by creating an incision in the cyst wall and then stitching the edges of the cyst to the surrounding skin.
effectively creating a pouch that allows continuous drainage. That is, when you do the IND, incision and drainage of Bartholin cyst, the one side is sutured and other side is kept open. This procedure is called marsupialization. But in this question, the term marsupialization is not mentioned, but you have to know this is the marsupialization case. So the correct code should be 56,440. If you see other codes, 56,740, that's it, excision of Bartholin cyst glandocyst. This is not the excision, this is incision and drainage. So the correct answer is answer C, that is 56,440. This is called marsupialization of Bartholin cyst. So if you go with the CPT index, you can go to the Bartholin cyst gland, then go to the subcategory cyst, then go to the subcategory of marsupialization. That will lead you 56,440. Again, you have to go back to the tabular list and confirm the answer. So the correct answer is C. Question number 6 of 50,000 series codes. A physician performed a biopsy of the thyroid with the use of a percutaneous core needle using fluoroscopic guidance. Aspirate was sent to the laboratory so that the pathology of the disease could be determined. What is the correct code for this procedure? So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, we have to highlight this is biopsy of the thyroid and percutaneous core needle using fluoroscopic guidance. And also the aspirate was sent to the laboratory for the pathology test. Okay, when you see the answers, all answers are adjacent. The first code is 60,000 and 60,100 and other codes are available. So you can use the elimination method to find the answer. So directly go to the codes. If you go to the code 60,000, it says incision and drainage of thyroglossal cyst infected. That is not the case here. Here we have done the biopsy. 60,100 is biopsy thyroid percutaneous core needle. So that is the case. Here you can see biopsy of the thyroid percutaneous core needle. But here an additional thing, that is using fluoroscopic guidance. So this code is not mentioning about the fluoroscopic guidance. But the additional note of the code says if imaging guidance is performed, see 76,000 codes and 77,000 codes. When you go to the code 76,942, that is ultrasonic guidance. But in our case, this is the fluoroscopic guidance. So when you go to the other code, that is 77,002, that is fluoroscopic guidance for the needle placement. So it is an additional code. You can see the plus mark. So you have to code the main code, that is 60,100 and 77,002. So the correct answer is C. The pathology codes 88,172 and 88,173 should not be coded by the physician because he or she did not perform the laboratory service. The lab performed the service separately and should code for the item separately. So in this case, you have to code only for the physician procedure here. So if you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. So when you go to the CPT alphabetic index, first you have to go to the biopsy or needle biopsy. Then you have to go to the subcategory of thyroid gland. That will lead you to the 60,100. Again, you have to go back to the tabular list and confirm the answer. Their additional note will guide you to imaging guidance. If the imaging guidance is performed, the additional codes we have to check. Again, when you check the codes, the 77,002 is suitable. So the correct answer is C. AAPC CPC Model Paper 1, Chapter number 12. In these chapters, we will be tested on 60,000 code series of CPT section is involved surgical procedures performed in the nervous system and will include the codes pertaining to the skull, meninges, brain, spine, spinal cord, extracranial nerves, peripheral nerves, and the autonomic nervous system. This section will consist of 6 questions. Question number 1. A physician performed craniotomy on a patient with a severe head trauma and intracerebral hematoma. Due to the patient's condition, the procedure was extremely difficult, requiring a significant amount of extra time and effort. What is the correct code for this procedure? So there are 61,000 codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is the craniotomy procedure done in a patient with a severe head trauma and intracerebral hematoma. The procedure required a significant amount of extra time and effort. When you see the answer, only two codes are there, 61,315 and 313 with additional modifiers. So you can use the elimination method to find the answer. So directly go to the codes. So when you directly go to the code, you can see 61,313, that is intracerebral. So this is the continuation of the previous code. The previous code says craniectomy or craniotomy exploratory intracerebral. So here this also intracerebral. So the correct code is 61,313. If you see other code 61,315, that is intracerebral. But in our case, this is intracerebral. So the correct code is 61,313. But that code only is not enough, because there was another case here. You can see the procedure required a significant amount of extra time and effort. So if any procedure needed extra time, you have to put the modifier. So when you go to the modifier of the first cover page of the CPT code, there you can see modifier 22, that is increased procedural services. 23 is unusual anesthesia. But in this case, the 22, that is increased procedural services, is the correct modifier. So the code 313 with correct modifier 22. So the correct answer is C. So if you encounter this case in a real working scenario, you have to find the answer using the CPT alphabetic index. So when you go to the CPT alphabetic index, there you have to go to the craniotomy. In the craniotomy, you have to go to the subcategory of evacuation of hematoma. Then it will lead you to the following code series, 61,312 to 315. Again, you have to go back to the tabular list and confirm the answer. Once you confirm the answer, you also have to go to the cover page of the CPT. There you have to find the modifier. So this correct modifier is 22. So the correct answer is C. Question number 2. A 40-year-old male has lumbar facet syndrome. Under fluoroscopic guidance, the affected nerve in the facet joints of the lumbar region is destroyed by a neurolytic agent in the right segmental medial branches innervating facet joints L3 to L4 and L4 to L5. What CPT codes are reported? So here you can see there are 64,000 code series are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case you have to highlight this is the lumbar facet syndrome and the procedure done using the fluoroscopic guidance in the affected nerve. So they are destroyed by neurolytic agent, the right segmental medial branches from L3 to L4 and L4 to L5. So when you see the answer, the nearby codes are used. So you can use the elimination method to find the answer. When you go to the code 64,493, that says injection, diagnostic or therapeutic agent. But in our case, this is not injection, it is destruction. So you can eliminate the answer A. Okay, when you see other codes, 64,633, destruction by neurologic agent, paravertebral facet joint nerves with imaging guidance, fluoroscopy or CT, cervical, thoracic, single facet joint. Here it says cervical or thoracic, but in our case it is lumbar. So 634 is cervical or thoracic with additional facet. If you see other code 64,635, that is lumbar or sacral single facet joint, plus 64,636 is lumbar or sacral is additional joint or facet. So here we have used two joints. So first one you can use the code 64,635. For the second one you can use the additional code 64,636. So 35 and 36, the correct answer is B. If you encounter this question in a real working scenario, you have to use the alphabetic index of the CPT codebook. So when you go to the CPT alphabetic index, here the procedure is the destruction. So you have to go to the destruction. There it will go to the nerve. When you go there, it will see nerves destruction. Again, go back to the nerves and go to the destruction. The subcategory says paravertebral facet joint. In this case, it will lead you to the code series of 64,633 to 36. Again, go back to the tabular list and confirm the answer. In this case, the modifier 51 is never appended to an add-on code. So they have used the add-on code here, that is 64,636. So there's no need for any modifiers. So the correct answer is B. Question number 3. A pediatrician performed a lumbar puncture on a 2-day-old premature infant weighing 2.3 kg with possible meningitis. What is the correct code for this service? So you can see the adjacent codes are available 62,272 and 70 with the modifiers. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you had to highlight this is the lumbar puncture done in a premature infant weighing 2.3 kilogram. Okay, when you go to the codes, 62,270 is spinal puncture lumbar diagnostic. 62,072 is spinal puncture therapeutic for drainage of cerebrospinal fluid by needle or catheter. But in here, it is used for the possible diagnosis of meningitis. So the correct code should be 62,270, spinal puncture lumbar diagnostic. But keep in mind, any infant less than 4 kilogram, you had to use the modifier. So here you can see the modifier 63 is used for procedure performed on an infant less than 4 kilogram. So the correct answer is not B, it's C. 62,270 with the modifier 63. So if you encounter this case in a real working scenario, you have to go with the CPT index. So in the CPT alphabetic index, you have to go to the lumbar puncture. There you have to go to the subcategory of diagnostic. It will lead you to the following two codes, 62,270 and 62,328. Again, go back to the tabular list and confirm the answer. Also, you have to use the modifier 63, that is procedure performed on infants less than 4 kilogram. So the correct answer is C. Question number 4. A 63-year-old female patient diagnosed with papillary carcinoma of the thyroid admitted for a total thyroidectomy. The neck and anterior chest are prepped and limited neck dissection is done on the thyroid side, dividing the isthmus on the right lobe side of the midline, removing the left lobe and several enlarged lymph nodes. Then dissection is performed on the right side, removing the right lobe from the trachea. Which CPT code is reported? So here you can see 60,000 series codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is the patient with papillary carcinoma of the thyroid. Here, total thyroidectomy is done with the limited neck dissection, removing the left lobe and several enlarged lymph nodes, also the right lobe from the trachea. So you can see the adjacent codes are available. So you can use the elimination method to find the answer. So if you see the code 62,220, that is total thyroid lobectomy, unilateral with or without splenectomy. 240 is thyroidectomy, total or complete. 252 is thyroidectomy, total or subtotal of malignancy with limited neck dissection. So this code is exactly matching the scenario. The thyroidectomy, total or subtotal for malignancy. Here the malignant patient undergone total thyroidectomy with the limited neck dissection. So the correct answer is C. Okay, if you encounter this case in a real working scenario, you have to go with the CPT alphabetics index. So when you go to the index, there you have to go to the thyroidectomy, the subcategory total, then the subcategory for malignancy, then subcategory limited neck dissection. It will give the code 60,252. Go back to the tabular list and confirm the answer. So answer will be C. Question number 5. A physician sutured 3 digital nerves in the left hand, the command sensory nerve in the left foot, and 2 command sensory nerves in the right foot. What codes need to be reported? So there are 64,000 codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight the following things. There are suturing of 3 digital nerves on the left hand, command sensory nerve on the left foot, and 2 command sensory nerves on the right foot. So you can find the answer using elimination method. Here you can see all 4 arms have 831 code and 832 like adjacent codes are available. So you can use the elimination method. So when you go to the 64,831, that is suture of digital nerve, hand or foot, 1 nerve. So here you can see 3 digital nerves in the left hand suture. So this code should be there. So 64,831. That is for only one nerve. 832 is each additional digital nerve list separately in addition to the code for the primary code. So first nerve is 64,831. Second nerve is 64,832. There's third nerve also. So you have to multiply by 2. So 64,831 and 64,832 into 2. So that is for 3 digital nerves of the left hand. When you go to the other code, 64,834, that is suture of one nerve, hand or foot, command sensory nerve. You can see command sensory nerve in the left foot, that is one nerve. So you can use once this code. So 64,834 and also 64,837, suture of each additional nerve, hand or foot. So you can see the command sensory nerve of one command sensory nerve in the left foot and also 2 command sensory nerves on the right foot. So you have to use this additional code multiply by 2. So the correct answer will be A. First code, the additional 2 nerves multiply by 2, and the second code and the additional 2 nerves multiply by 2. So correct answer is A. If you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, this procedure is suture. So go to the index of suture and go to the subcategory nerve. Now it will lead you to the code series of 64,831 to 876. Again, go back to the tabular list and confirm the answer. Once you confirm the answer will be A. The final question of 60,000 series codes. A 53-year-old woman has been having significant sciatica. She is going to have a neuroplasty of sciatic nerve. What is the correct code for this procedure? So you can see 64,000 adjacent codes 702, 4, 8 and 12. So please pause the video, take your CPT code book and find the answer. This is a straightforward one. Okay, in this case you have to highlight this is the sciatica and neuroplasty of the sciatic nerve is done. So when you check the codes, 64,702 is neuroplasty digital one or both or same digit. 704 is nerve of the hand or foot. 708 is neuroplasty major peripheral nerve, arm or leg open other than specified. 712 is sciatic nerve. So this is the continuation of previous code. So neuroplasty, sciatic nerve. So the correct answer is D, 64,712. If you encounter this case in a real working scenario, you have to go with the CPT index. So in the index, first you have to go to the main procedure, that is neuroplasty, then go to the subcategory of peripheral nerve, then go to sciatica. So it will lead you to the code 64,712. So the correct answer is chapter number 13, radiology codes. There are 6 questions. These questions will focus on both diagnostic and interventional radiology, including diagnostic ultrasound, radiologic guidance, mammography, bone and joint studies, radiation oncology, and nuclear medicine. Question number 1. A 45-year-old female patient with severe endometriosis received a CT scan of the pelvis and abdomen with and without contrast. What radiology code should be reported? So there are 474,000 codes are available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here you have to highlight this is severe endometriosis, CT scan of the pelvis and abdomen with and without contrast. Okay, if you see the codes, the adjacent codes are used 74,176, 77 and 78 and other 2 codes available. So let's use the elimination method to find the answer. So directly go to the codes. When you directly go to the codes, you can see 74,176 is computer tomography, abdomen and pelvis without contrast material. But in our case, both with and without contrast material used. So the other code is 74,177, that is with contrast materials. So if you use 176 and 177, it may contain the without contrast and with contrast. But do not hurry. You have to check the other answer. That is 74,178. That is computer tomography, abdomen and pelvis, continuation, without contrast material in one or both body regions, followed by a contrast materials and further sections in one or both body regions. Here you can see 176 is without contrast material, 177 is with contrast material, but 178 is with and without contrast material. So in the case, we have used CT scan of pelvis and abdomen with and without contrast material. So the both the procedure is included in the single code, that is 74,178. So instead of A, you have to select the answer B. This is very careful. Also, you have to note the additional note, that is report 74, 176, 177 or 178 only once per CT abdomen and pelvis examination. So here the with and without contrast, it is coded in a single code, that is 74,178. So the correct answer is B. If you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. So in the CPT alphabetic index, you have to go to the CT scan, then go to the subcategory of abdomen, lead you to the following codes. Then you have to go back to the tabular list and have to confirm the answer. So once you confirm the answer, the correct answer will be B. Question number 2. For a 2-year-old presenting with right upper arm pain, where X-rays of the right humerus, anterior, posterior, and lateral views are obtained and show no fracture dislocation or other abnormality. The correct CPT and ICD-10 CM codes for the physician service are, so there are 473,000 codes are available with the ICD-10 codes. So please pause the video, take your CPT and ICD-10 CM code books and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is 2-year-old child presenting with the right upper arm pain. X-rays of the right humerus, anterior, posterior, and lateral views shows there's no fracture, no dislocation, or other abnormalities. So let's go to the CPT codes. So you can see the adjacent codes are used. So you can use the elimination method to find the answer. When you go to the CPT code, 73,050 is radiologic examination, acromial clavicular joints, bilateral. 73,060 is, that is the continuation code of the previous one, that is radiologic examination, humerus, minimum of two views. So here you have used anterior, posterior, and lateral views. So there are more than 2 views are used. So you can use this code 73,060. But you can see 73,092, that is also continuation code of the previous one, that is radiologic examination, upper extremity, infant, minimum of 2 views. So you have to be very careful with the age. The infant is less than 1 year, but here the child's age is 2 years. So this is not the infant. So you have to be careful. The infant is less than 1 year. Here the child is 2 years. So no need to use this code. So the correct code is 73,060. So you can see the answer. The A have the 73,060 and B also having the 73,060. But the additional modifier 26 is used because after taking the X-ray, the physician is interpret that there's no fracture, dislocation, or other abnormalities. In this case, the modifier 26 should be used because there's a professional component, because the physician interpreted the X-ray that there's no dislocation. So for this professional component, you have to add the modifier 26. So you can eliminate the answer C and D. So let's check the ICD-10 CM codes. So when you go to the ICD-10 CM M79.62, that is pain in upper arm, and 621 is pain in right upper arm, because in this case there's no other diagnosis available. Only the diagnosis available here is the symptom. The patient having pain in upper arms, there's no fracture, dislocation, or abnormality. So in this case, without any diagnosis, you can use the symptom as the diagnosis. So in this case, you can use the code M79.621, that is pain in upper arm. If you see other code, that is R93.89, that is abnormal finding on diagnostic imaging of other specified body structure. But here there's no abnormalities available. So the correct answer will be A. So if you encounter this case in a real working scenario, you have to use the index of the CPT code book and ICD-TM code book. So if you go to the CPT alphabetic index, there you have to go to the X-ray, then go to the subcategory of humerus. It will lead you to the code 73,060. Again, go back to the tabular list and confirm the answer. And if you go to the ICD-10 CM alphabetic index, here the diagnosis will be pain. So go to the pain, then go to the subcategory of limb, again go to the subcategory of upper or upper arm, then you will find the codes M79.62. Again go back to the tabular list and confirm the answer. So once you confirm the answer, the correct answer will be A. Question number 3. A cardiologist who reviews and interprets the results of an abdominal aortography performed with the serialography on a 53-year-old female patient with atherosclerosis. Which CPT code should be reported? So there are 4 75,000 series CPT codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is cardiologist who reviews and interprets abdominal aortography performed with the serialography patient with atherosclerosis. When you see the answer, all answers are adjacent answers 75,625, 625 with modifier, 605, and 630. So you can use the elimination method to find the answer. So directly go to the codes. When you directly go to the codes, the 75,625 is aortography, abdominal by serialography, radiological supervision, and interpretation. So this is exactly matching the scenario here. Aortography with the serialography, radiological supervision, and interpretation. So the correct code is 75,625. Here there's a professional component is involved. So do we need to add the professional code, that is the professional modifier 26 for the professional component? But here keep in mind the code itself says the professional part. For example, here you can see radiological supervision and interpretation. So the interpretation part is already included in the code. So there's no need for additional modifier. So you have to be very careful with answer A or answer B. Here, actually the professional component is involved, but that professional part is already included in the code. So the correct code will be A. If you see other answers, 605, that is aortography thoracic. But here it is abdominal aortography. 630 is aortography, abdominal plus bilateral iliofemoral. But here only the abdominal part, that also including the professional component. So the correct answer will be A. So if you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, go to the index of aortography. There go to the subcategory of aorta imaging. It will lead you to the following code series, 78,600 to 630. Again, go back to the tabular list and you have to confirm the answer. So the correct answer will be A. Question number 4. A patient undergoes a CT scan of the abdomen and pelvis. The imaging study includes multiple axial images acquired after the administration of both oral and intravenous contrast material. What is the correct CPT code to report for this diagnostic imaging service? So there are 74,000 and 72,000 code series are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here you have to highlight this is CT scan of the abdomen and pelvis with multiple axial images after the administration of both oral and intravenous contrast material. So when you see the answer, there are adjacent codes are used here. So you can use the elimination method to find the answer. So directly go to the codes. When you directly go to the code, the 74,150 is computed tomography abdomen without contrast material. 160 is with contrast material. But here abdomen. But in our case, the CT scan for abdomen and pelvis. So the 160 is not suitable here. But you see 170 without contrast material followed by contrast material and further sessions. So 170 also not suitable because here we are only using the contrast material. 174 is computer tomographic angiography abdomen and pelvis with contrast material. But here there's no angiography involved, only the CT of the abdomen and pelvis. So 74 also not suitable. 176 is computer tomography abdomen and pelvis without contrast material. 177 is with contrast material. So in our case is CT scan of abdomen and pelvis with the contrast material. So the correct answer will be 74,175. That is answer B. If you see other answers, 72,192, that is computer tomography pelvis without contrast material. and 197 is with contrast material. Here it only says the pelvis. So in this case, our case is abdomen and pelvis with contrast material. So the correct code will be 74,177. So the correct answer will be B. If you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, here this procedure is a CT scan. So go to the CT scan. There you have to go to the subcategory of with contrast. Again go to the subcategory of abdomen. There it will lead to following code 74,160 and 74,077. So again go back to the tabular list and confirm the answer. Once you confirm the answer will be B. Okay, question number 5. Radiation oncology codes consist of a specialized portion of radiology codes that are used to report which of the following: A. Radiation services provided by the oncologist. B. Radiology services that are used to treat benign neoplasms. C. Radiological services that are used to deliver radiation treatment to tumors. D. Radiation services that are provided in hospitals. So, in addition to the codes, you may get following type of theoretical questions. So, please pause the video, think of an answer.
3, 2, 1.
So the radiation oncology is a medical specialty that uses radiations like X-rays, gamma rays or protons to treat the cancer and certain benign conditions. The CPT code specifically for radiation oncology, that is 77,000 series in CPT book, describe the planning, delivery and management of the radiation treatments. But the first answer, radiation services provided by oncologist. That's true, but not only by oncologists, but other technician or normal physician also giving radiologist treatment. So it is partially correct. And also the radiation treatment sometimes used to treat the benign neoplasm, but most of the time it is for the malignant neoplasm. But here the answer B is partially correct because it says it's used to treat the benign neoplasm, but in real working scenario it is given for the malignant neoplasm as well as benign neoplasm. So the answer B also partially correct. So the core purpose of the code is to report the delivery of radiation treatment to tumors. So the correct answer will be C. So which is the primary focus of the radiation oncology. Also the radiation services can be provided in various settings, not just hospitals. So the answer D also partially correct. So in this case, the most accurate and comprehensive description is answer C. That is radiological service that are used to deliver radiation treatment to tumors. The last question of the radiology series, that is question number 6. A physician orders a transvaginal ultrasound for a young woman presenting with right lower abdominal pain and a medical history of ovarian cyst. The primary objective of this diagnostic imaging is to evaluate for an ovarian cyst as the etiology of her pain. Which CPT code accurately represents this ultrasound service? So you can see there are 76,000 code series available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here you have to highlight this procedure is the transvaginal ultrasound on the right lower abdominal pain with the history of ovarian cyst. So this is a diagnostic imaging to evaluate the ovarian cyst. So when you see the answer, you can see all answers are adjacent code 76,800 and something. So you can use the elimination method to find the answer. So directly go to the codes. When you go to the code, the 76,801 is ultrasound pregnant uterus real time with image documentation. Here it is for the pregnancy. So that is not the case here. When you see other code 76,830 ultrasound transvaginal. So that is the case here. Let's see other answers whether they have the additional information. 76,856, that is ultrasonic pelvic non-obstetric real time with image documentation, but this is not the case. Our case is the transvaginal, but this is pelvic. 76,857 is limited or follow-up, for example follicles. So in our case this scan is for the transvaginal ultrasound, so that is exactly matching the code 76,830, that is ultrasound transvaginal. So the correct code will be B. So if you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, this procedure is the ultrasound scanning. So first you have to go to the ultrasound. Again, you have to go to the subcategory of transvaginal examination. Then it will lead to the code 76,830. Again, go back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be B.
Chapter 14, Pathology and Laboratory Codes. There are 6 questions. This section will test your knowledge of organ and disease panels, drug testing, therapeutic drug assays, evacuation or subtraction testing, consultation, urine analysis, molecular pathology, MAAA, chemistry, hematology and coagulation, immunology, transfusions, microbiology, anatomic pathology, cytopathology, cytogenic studies, surgical pathology in vivo, and reproductive. So let's go for the first question. For a routine gynecological exam, a pap smear is obtained from the cervix of a 42-year-old female. The screening is conducted using an automated system with provider oversight. What CPT code is appropriate for this service? So there are 488,000 series codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this question, you have to highlight this is a routine gynecological examination. Here, the pap smear is obtained for screening using automated system with provider oversight. So when you see the codes, all are 88,000 codes and adjacent codes are available. So you can use the elimination method to find the answer. So let's go directly to the codes. When you go to the code 88,164 is cytopathology slides cervical or vagina. It's a manual screening under physician supervision. So here manual, but in our case it is automated system with the provider oversight. So this code is not suitable. 174 is cytopathology cervical or vagina. Any reporting system collected in preservative fluid, automated thin layer preparation, screening by automated system under physician supervision. In this case, the pap smear specimen is prepared by automated thin layer preparation. But in our case, it is not mentioned. Normally, it is made by manually. But 174 says it is automated thin layer preparation. So that is also not suitable. When you see other codes, 88,147, that is cytopathology smears, cervical or vaginal, screening by automated system under physician supervision. So here you can see this is cytology smear. So pap smear for here, cytology smear, cervical or vaginal, purpose of screening, automated plus physician supervision. All the explanations are exactly matching the case. So the correct answer should be 88,147. If you see other code 148, screening by automated system with manual rescreening under physician supervision. So in this case, only automated plus physician supervision, but this case automated and manual. So that code also not suitable. So the correct answer is answer C, 88,147. So if you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, first go to the code cervical smears. So this is a pap smear, so go for the cervical smear. Again, you have to go to the subcategory of cytopathology. Then go to the subcategory of partially automated screen. So it will lead you to the following two codes, 88,147 and 148. Again, go back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be C. Question number 2. A patient was brought to the emergency department following a car accident, suspecting the patient had been drinking and driving. The physician ordered a alcohol pathology test. After determining that the patient did indeed have alcohol in their system, the physician then ordered a pathology test to check the amount of alcohol in the bloodstream. So here you have to find the answers to the both dashes. So there are 4 answers: qualitative and quantitative, pathological and cytopathological. So please pause the video and think the answer.
3, 2, 1.
Okay, here the correct answer is, the first one is qualitative, second one is quantitative. In this case, suspecting that the person had been drinking and driving, the physician ordered a qualitative alcohol pathology test. After determining that the patient did indeed have the alcohol in their system, the physician then ordered the quantitative pathology to test the amount of alcohol in the bloodstream. A qualitative pathology checks only for presence of specific substance, in this case alcohol. After the qualitative results come in positive, a quantitative test checks for the actual amount of substance in the bloodstream. Question number 3. During the surgical session, the pathologist received and performed analysis on 3 separate biopsies from vaginal wall and 1 from the cervix. How should the surgical pathologist code for these surveys? So there are 4 answers. All answers are similar answers, 88,305 and 307. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight pathologist received and performed analysis on 3 separate biopsies from the vaginal wall and 1 from cervix. So altogether, 4 samples are received. So if you see the codes, all 4 answers having the 88,305 and 2 answers having 88,307 with multiples are also available. So you can use the elimination method to find the answer. So directly go to the codes. When you go to the code, this is in the surgical pathology. So there are 5 categories. You have to go through and find the answers. So I'll show you in the real time. So when you go to your CPT code book, it will appear like this. It will say the surgical pathology. 88,300 is level 1, that is surgical pathology, gross examination only. But in our case, it is a microscopic. 88,302, you can see level 2 surgical pathology, gross and microscopic examination. So you have to find the answers in this course. So in our question, we are doing the biopsy on cervix and the vagina. So you have to search for the vagina. Here you can see vaginal mucosa. So that is not suitable. Go down, other codes 304. Here also you have to check whether those that is listed here. Those are listed in alphabetic order, so you can check easily. 88,305, that is level 4 surgical pathology, gross and microscopic examination. So here you can see cervix biopsy. So cervix biopsies are available here. And also if you go down, you can see vagina biopsy also available here. If it is not listed here, you can go to the other code 88,307. So in this case, the both codes, cervix biopsy and vagina biopsy, included in the level 4 code, that is 88,305. So let's come to the question. So here you can see both the codes are available in the 88,305, cervix biopsy and vagina biopsy available. So the question, you can see the perform 3 separate biopsies from the vaginal wall and 1 from the cervix. So there are altogether 4 samples. All the 4 samples are included in the code 88,305. So you have to multiply this 88,305 into 4. So the correct answer is C. If you find this question in a real working scenario, you have to go with the CPT alphabetic index. So in the CPT alphabetic index, first you have to search for the surgical pathology. Then go for the subcategory gross and microscopic examination. Here it will lead you to all the 6 levels, level 1 to level 6. Again, you have to go back to the tabular list and confirm the answer. Once you confirm, all the codes are included in the level 4, that is 88,305. 4 samples are received, so you have to multiply it by 4. So the correct answer is C. Question number 4. A patient with acute asthma exacerbation underwent spirometry. Albuterol 1 mg was administered via nebulizer, followed by repeat spirometry. Post bronchodilator studies with 2 of 3 attempts successful revealed an obstructive pattern and partial resolution of wheezing, but continued restricted airflow. What is the appropriate CPT code for this pulmonary function testing? So there are 4 codes available, 94,010, 12, 60 and 70. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight the following things. This is acute asthma exacerbation, underwent spirometry. There is a drug given by a nebulizer, followed by repeat spirometry. Post-bronchodilator studies with 2 of 3 attempts successful. Finally, the partial resolution of wheezing, but continued restricted airflow is there. So when you see the answers, all answers are adjacent answers of 94,000, 10, 12, 60 and 70. So you can use the elimination method. So directly go to the codes and find the answer. So when you directly go to the code 94,010, that is spirometry, including graphic record, total and tight vital capacity, expiratory flow rate measurement with or without maximal voluntary ventilation. So here it is not mentioning any drug given or the final output, that is a continued restriction airflow, not mentioned here. So when you go to the second code 94012, measurement of spirometric force expiratory flows before and after bronchodilator in an infant or child through 2 years of age. So here this says in an infant or child through 2 years of age, but in this case the age is not mentioned, so we can't take it as the infant. So let's go to the next code 94060, bronchodilation responsiveness spirometry as in 94010. So 94010 is this one. So this 94060 include the 94010 as well. So pre and post bronchodilator administration. So this is exactly matching the scenario. So this include the code 94010. So you have to take both as one code. So the correct answer should be C, that is 94060. So if you encounter this case in a real working scenario, you have to go with the alphabetic index. When you go to the CPT alphabetic index, the only code available is spirometry. When you go to the spirometry, it will lead you to the following code series. Again, you have to come back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be C. Question number 5. A comprehensive metabolic panel and a general health panel is ordered and performed on a patient. What is the correct CPT coding for these laboratory orders? So you can see there are 80,000 codes available. So please pause the video, take your CPT code books and find the answer.
3, 2, 1.
In this case, you have to highlight this is comprehensive metabolic panel and general health panel. When you see the answer, all the codes are adjacent codes. You can see 80,000, 53, 50, 51 and 48. So you can use the elimination method. So directly go to the code and find the answer. When you go to the code, you can see 80,048, that is metabolic panel, calcium total. So in our case, comprehensive metabolic panel and general health panel. So that is one part is available here. When you take 80,050, that is general health panel. So one part is here. This panel must include the following: comprehensive metabolic panel. So this 80,050 include the comprehensive metabolic panel plus general health panel. So the one code itself denoting the scenario here. So no need for the additional code. So you can select this 80,050, that is answer B. It's a single code. In this code, the general health panel, this panel must include the following, that is comprehensive metabolic panel. So the comprehensive metabolic panel and general health panel both are included in the code 80,050. So the correct answer is B. So if you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, first search for the term panel. So go to the panel, then go to the subcategory organ or disease oriented panel. There you will get the following three lists. One is basic metabolite, then comprehensive metabolite, then general health. Again, go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be B. Question number 6. An established patient come in complaining of nausea and vomiting and states she has not had a menstrual period in over a month. A complete CBC and automated differential WBC is ordered. The provider also orders hepatitis B antigen, rubella, RPR, antibody screening, blood typing for RH-NABO, and urine pregnancy test. What is the correct CPT coding for the laboratory testing? So there are 4 answers available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight. So if you are familiar with this kind of coding, you have to know this test, that is hepatitis B antigen, rubella, RPR, this kind of tests are pregnancy panel tests. So you can see the answers 80,055 and some other code series are used here. So you can use the elimination method to find the answer. So directly go to the code. So once you go to the code, you can see 80,055, that is obstetric panel. So this panel must include the following. So here blood count, complete CBC, automated and differential WBC. So that is the first test we have done. And the blood count, hepatitis B surface antigen, you can see hepatitis B surface antigen here. And the antibody for rubella, that is here. Then syphilis test, that is RPR, so that also mentioned here, and antibody screening, that's also here. Blood typing and ABO, blood typing RH, so those things done here. Blood typing for RH and ABO, such that is also included. So all the tests are included in one code except urine pregnancy test. So you can see there's no urine pregnancy test in this list. So for all other tests, you can use one code, that is obstetric panels. But only exception is this urine pregnancy test is not included here. So if you go to the code 81025, that is urine pregnancy test by visual color comparison method. So that also included here. So two code is enough for this scenario. So that is 80,055 and 81,025. The correct answer is C. So if you encounter this case in a real working scenario, you had to go with the CPT alphabetic index. So in the CPT alphabetic index, you had to go to the blood test first, then go to the subcategory of panels, then go to the obstetric. So you will find the obstetric code. For the second part of the code, that is urine pregnancy test, you have to go to the urine analysis, then go to the subcategory pregnancy test. It will lead you to the code 81,025. Again, go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer C. Chapter number 15, Medicine, 6 questions. This will cover numerous specialty specific coding scenarios as well as immunizations, biofeedback, dialysis, central nervous system assessments, health and behavior assessments, hydration, medical nutrition, therapeutic and diagnostic administration, chemotherapy administration, photodynamic therapy, osteopathic manipulative treatment, patient education and training, non-face-to-face, non-PCCN services, and moderate sedation. So let's see the first question. Question number 1. Patient with severe strabismus visited the ophthalmologist clinic for a strabismus correction surgery. The ophthalmologist performed the surgery by correcting 2 horizontal muscles and 1 vertical muscle in the patient's right eye. The physician then used a transposition procedure on the superior oblique muscle in order to further correct a misalignment. What is the correct way to code for the procedure? So there are 4 answers available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is severe strabismus case. Patient visited the ophthalmologist for the strabismus correction. So the correcting surgery, 2 horizontal muscles and 1 vertical muscle in the patient's right eye. Transposition procedure on the superior oblique muscle in order to further correct the misalignment. So when you see the codes, you can notice that the first answer, that is 67,311 and 12, available in the all 4 answers. Other than that, 314 and 320 also available. So you can use the elimination method to find the answer. So directly go to the code. Okay, when you go to the codes, you can see this is extraocular muscles, 67,311. That is strabismus surgery, recession or resection procedure, 1 horizontal muscle. So when you read the case, you can see the correcting 2 horizontal muscles. So there are 2 horizontal muscles. So the 2 horizontal muscles are listed in the 67,312. 2 horizontal muscles. So this code should be coded. So that is available in B and C. Other than 2 horizontal muscle, you can see 1 vertical muscle in the patient's right eye. So 1 vertical muscle also you have to code. So you can see 67,314. That is 1 vertical muscle, excluding the superior oblique. So 312 and 314 should be there. Again, B and C is suitable. So let's see the other answer. Other one is transposition procedure on the superior oblique muscle. So you can see 67,320 is the transposition procedure. That is on the for the extraocular muscle. So this code should be there. So also the additional note says use 67,320 in conjunction with 67,300 level to 380. So any of this code you can use this additional code. So this transposition procedure also should be coded. So the correct answer will be answer B. That is 67,312 horizontal 2 muscles, 14 for vertical 1 muscle, and 320 for transposition procedure for superior oblique muscle. So if you encounter this case in a real working scenario, you have to go to the CPT index. So in the CPT index, you have to go to the strabismus, then go to the repair. In the repair, you can go to the subcategories transposition, that is 67,320, 2 horizontal muscle, that is 67,312, and 1 vertical muscle for 67,340. So again, the answer will be B. Question number 2. An 11-year-old established patient presents with high fever and sore throat. The mother calls at closing time and the office remains open for their arrival. The physician performs a medically appropriate history and examination with low complexity medical decision making. What CPT codes are reported? So there are 4 codes available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
In this case, you had to highlight this is an established patient and mother codes at the closing time, and it is a low complexity medical decision. So when you see the CPT codes, you can see the first code is 99,213 and 212, only 2 codes, and other code is 99,058 and 50 and 51. So adjacent codes are available. So you can use the elimination method to find the answer. So directly go to the codes. When you directly go to the code, 99,212 is office or other outpatient visit. Here, straightforward medical decision making. But in our case, you can see it's a low complexity medical decision. So 99,213 is office or other outpatient visit, low level of medical decision making. So this code will be the correct code for the first scenario. So you can omit other 2 answers with 212. So let's check the other codes. Okay, 99,050, that is service provided in the office at times other than regularly scheduled office hours. So in this case, you can see patient called for the closing time and the office is open till their arrival. So this code is suitable. But other codes, you can see 951 is office during regularly scheduled evening. 90,058 is services provided on an emergency basis. But this is, in this case, is a office open for extra time. So correct code will be 99,050. So the correct answer will be answer C. So if you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, you have to go to the office and or other outpatient services. There you have to go to the subcategory of established patient. It will lead you to the code 99,211 to 215. Again, go back to the tabular list and confirm the answer. The second part of the question, you have to go to the office medical services, then go for the subcategory of after hours. That is coded as 99,050. Again, go back to the table list and confirm the answer. Once you confirm, the correct answer will be answer C. Question number 3. A 65-year-old patient with decreased hearing decided to undergo bilateral cochlear device implantation in order to restore the gradual decline of his hearing and prevent total deafness. Due to the position of the device and the size of the patient's mastoid bone that was partially occluding the patient's inner ear, the physician performed a modified mastoidectomy. A mastoidectomy was necessary for the completion of the cochlear device implantation procedure. The physician used an operating microscope throughout the cochlear implantation. How would you code for the procedure? So there are 4 answers available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here you have to highlight this is bilateral cochlear device implantation. Physician performed modified mastoidectomy. Here the physician used the operating microscope throughout the surgery. When you look at the codes, you can see all 4 answers having 69,930 with the modifier 50, and other codes also adjacent codes. So you can use the elimination method to find the answer. So directly go to the codes. When you go to the codes, you can see 69,930 is cochlear device implantation with or without mastoidectomy. So here you can see bilateral cochlear device implantation. So if it is bilateral, you have to use the modifier 50. You can see the modifier 50 is 50 for bilateral procedure. So in this case, you have to use the 69,930 with modifier 50. The code 69,505 is not suitable because it is modified radical. That is mastoidectomy modified radical. This is only coding for the mastoidectomy. But in our case, bilateral cochlear device with the mastoidectomy. So the 930 will be the suitable answer. That is cochlear device implantation with or without mastoidectomy. So when you see the other code, that is 69,990 regarding the microscope, you can see 69,990 is a microsurgical technique requiring use of operating microscope. So list separately in addition to code for the primary procedure. The primary procedure is 69,930 with the modifier 50, and additionally the microsurgical techniques, you have to use the additional code. The correct answer will be answer D. So if you encounter this case in a real working scenario, you had to use the CPT alphabetic index. When you go to the alphabetic index, this is the implantation procedure. So go to the index of implantation. There you will find the subcategory of cochlear device. It will lead you to the code 69930. Again, go back to the tabular list and confirm the answer. The second part, that is microscopic surgery, you have to go to the microscope surgical. The subcategory operating microscope, it lead you to the code 69990. Again, go back the tabular list and confirm the answer. Once you confirm, the correct answer will be answer D. Question number 4. An 80-year-old patient is seen for a preventive medicine service. As a part of this visit, the physician performs a visual acuity screening using the Rosenberg test and a hearing screening involving responses to varied tones and intensities. Select the appropriate CPT codes for this screening. So there are 4 answers available, all are with 2 codes. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
In this case, we have to highlight this is a preventive medicine service. The first scenario is visual acuity screening using the Rosenberg test. Second screening is hearing screening involving responses to varied tones and intensities. So when you look at the answers, you can see the adjacent codes are available. The first code is 99,170, 73 and 74. Second code is 92,550 and 51. So you can use the elimination method to find the answer quickly. So directly go to the code. Once you go to the code 9970, that is anogenital examination magnified. So this is not relevant here. The 1972 is visual function screening, automated and semi-automated. 9973 is screening test of visual acuity, quantitative bilateral. So this is a suitable answer. So you can find C and B are possible. So other 2 answers you can omit. One, you can see 199, 174, that is instrument-based ocular screening. So that is not used here. So let's find the second code. So when you go to the second code, you can see 92,550 is tympanometry and reflex threshold measurements. 92,552 is screening test, pure tone, air only. In this case, you can see hearing screening involving responses to varied tones and intensities. So that is coded here, screening test, pure tone, air only. So the second code will be 92,551. So the correct code will be answer C. So if you encounter this case in a real working scenario, you have to deal with the CPT index. So when you go to the CPT index, first go to the visual acuity screen. Then you can go to the subcategory of automated. It will lead you to the code 99,172 and 73. Again, go back to the tabular list and confirm the answer. The second part of the question, audiology function test, that is the index. Go to the subcategory screening 92,551. Again, go back to the tabular list and confirm the answer. Once confirm the answer, the correct answer will be answer C. Question number 5. A patient with a suspected cardiac arrhythmia was given a routine rhythm EKG with 3 leads in the cardiologist's office. The results of the EKG were sent to the patient's primary care physician, who interpreted the results and determined the patient's arrhythmia was mild. What is the correct code for the cardiologist office service only? So there are 4 codes available. Those are adjacent codes. So please take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, we have to highlight this is a routine rhythm EKG with 3 leads in the cardiologist office. So the question is code for the cardiologist office service only. So there are 2 physicians involved. First one is this cardiologist office physician. Other one is who is interpreted the results. But question asking only for the cardiologist office service. When you look at the answer, you can see 93,040, 41, 42 are available. So you can use the elimination method to find the answer. Directly go to the codes. In this case, there are 2 scenarios involved. One is ECG taken in the cardiologist office, and the report and interpretation done by the primary care physician. So the question asks only the code for the cardiologist office service. So 93,040 is rhythm ECG 1 to 3 leads with interpretation and report. But here the interpretation and report part is not asked for the question. So 93,041 is tracing only without interpretation and report. So this is the correct answer because the cardiologist office only done the tracing part. The interpretation and reporting done by the primary care physician. If you take other code, 93,042 is interpretation and report only. This part is done by the primary care physician. So for this question, the correct answer will be answer B. If you encounter this case in a real working scenario, you have to deal with the CPT alphabetic index. When you go to the CPT alphabetic index, first you have to go to the electrocardiography, then go to the subcategory of rhythm. Go to the rhythm and go for the tracing. It will lead you to the code 93,005 and 93,041. Again, go back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer B, that is 93,041. Question number 6. Which CPT code represents the endocrinology service for ambulatory continuous glucose monitoring of interstitial tissue fluid, including the physician's reading and interpretation of the report's finding over a 72 hours period? So there are 4 answers available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
In this case, you have to highlight this is the ambulatory continuous glucose monitoring of interstitial fluid, including physician reading and interpretation over 72 hours. So when you look at the answers, you can see adjacent codes are used. 95,250, 51 and also 99,091 codes are available. So you can use the elimination method to find the answer. So directly go to the codes. When you directly go to the codes, 95,250 is ambulatory continuous glucose monitoring of interstitial fluid via a subcutaneous sensor for minimum of 72 hours. Physician or other qualified healthcare professional provided equipment, sensor placement, hookup, calibration of monitor, patient training, removal of sensor, and printout of recording. So here the second part is 95,252 is analysis and interpretation of report. So this code includes the previous codes part up to this semicolon. So ambulatory continuous glucose monitoring of interstitial tissue fluid via a subcutaneous sensor for minimum of 72 hours, analysis, interpretation and report. So here you can see the physician read and interpretation of the report. So the correct code will be 95,251. So there are no need of any other additional code. So the correct answer will be answer C. So if you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, go to the index of glucose. There you have to go to the subcategory of interstitial fluid. In the subcategory of continuous monitoring, it will lead you to the code series of 94,242 to 51. Again, go back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer C. Chapter number 16, Evaluation and Management, 6 questions. This area will assess your coding proficiency related to place and level of services, such as office or other outpatient, hospital observation, hospital inpatient, consultations, emergency department, critical care, nursing facility, domiciliary and rest homes, and home services. It will also include questions directed at preventive medicine, non-face-to-face services, neonatal and pediatric critical care, intensive care, prolonged services, chronic care, transitional care, care management, and care plan oversight. Let's go to the question number 1. When selecting an evaluation and management code, what is the first thing that the coder needs to determine? A. The time the provider spent with the patient. B. Whether the patient was new or established. C. The appropriate category of E&M service. D. How long the discharge took. So please pause the video, think the answer. The correct answer is C, the appropriate category of E&M service. When selecting an evaluation management code, the first thing that the coder needs to determine is the appropriate category of E&M service. This means that the coder needs to determine whether the service was provided in hospital inpatient or office or outpatient, hospital observation, etc. Whether the patient was new or established would only be a question in certain categories. In addition, the time spent with the patient is only a determining factor in certain categories. So, for all cases, appropriate category of E&M service should be determined. Question number 2. A new patient was seen in the office complaining of ear pain, headache, and a mild fever. The physician performed a problem-focused history assessment and then expanded problem-focused examination on the patient. The physician diagnosed the patient with an acute inner ear infection. The medical diagnosis was considered to be of low complexity. What is the correct E&M code for the service? So there are 4 codes available. Please pause the video and take your CPT code book and find the answer.
3, 2, 1.
Okay, these type of questions, before highlighting the question, you have to see the answers. So when you look at the answers, you can see the nearest codes are used and only one code of ENM code used. So if it is a ENM problem, you are no need to worry about the signs and symptoms of the disease. Only you have to worry about the place of the patient encounter, whether the patient is new or old, established. Then you have to consider the diagnosis, which is a straightforward, low, moderate, or advanced. So in this case, you can see the patient is new. The consultation happens in the office of the physician, and the medical diagnosis was considered to be a low complexity. So you can see all the nearest codes are used here. So you can use the elimination method to find the answer. So directly go to the codes. When you look at the codes, the 99,202 is office or other outpatient visit, the straightforward medical decision making. But in our case, it's a low complexity decision making. 99,203 is office or other outpatient. Here you can see the low level of medical decision making. So this code is more appropriate for the question. So the correct answer will be answer B, 99,203. If you look at other codes, you can see this is for the 211 office or other outpatient visit. This is for the established patient, but in our case, it's new patient. 212 also office or outpatient visit for the established patient, but in our case, it's a new patient. So if you encounter this case in a real working scenario, you have to find the answer using the CPT alphabetic index. So when you go to the CPT alphabetic index, first you have to go to the evaluation and management services, then go to the subcategory of office or other outpatient visit. There you have to find the subcategory of new patient. So it will lead you to the code 90,202 to 205. Again, go back to the tabular list and confirm the answer. So once you confirm, the correct answer will be B. Question number 3. A 2-year-old comes in for an initial well child exam. Mom doesn't have the child's immunization record. She states the child's last shot was when he was 5 months old. The physician orders the immunizations to be given in the office today. Immunization given subcutaneously, MMRV. What CPT codes are reported? So there are multiple codes for each answer. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is a 2-year-old child and child come for the initial well child examination, but the physician orders for immunization to be given in the office. The immunization subsequently MMRV. So when you look at the answers, there are adjacent codes are used here. So you can use the elimination method to find the answer. But in case of vaccination, you had to know that the route of administration and the name of vaccine should be coded separately. So let's go to the codes. When you go to the code, 381 is initial comprehensive preventive medicine. Actually, this patient come for the initial well child examination. That's the preventive part. So here, the age is younger than 1 year. The 381 says age is younger than 1 year, but in our case, the child is 2-year-old. So the second code, 99,382 is early childhood, age 1 through 4 years. This code may be suitable. So all 4 answers, C is suitable with this code. So the C may be the correct answer, but we have to confirm other codes as well. Do we need the modifier here? Yes, the modifier 25 is needed. The modifier 25 is significant, separately identifiable evaluation and management service by the same physician or other qualified healthcare professional on the same day of the procedure or other service. In this case, the child came for the preventive initial well child examination, but the same day the physician given the immunization. So there are 2 procedures involved. So because of that, this modifier 25 also need to add that. All answers have the modifier 25, so you no need to confuse about that. So the correct answer will be C. So let's see other answers. So when you look at the code 9471, that is immunization administration includes percutaneous, intradermal, subcutaneous or intramuscular injection, one vaccine, single or combination vaccine. So in our case, the vaccine given as the subcutaneously is a combination vaccine, MMRV. So when you look at the vaccine code, that is 9070 is measles, mumps, rubella and varicella vaccine, that is MMRV, measles, mumps, rubella and varicella vaccine, live for subcutaneous use. So this code also suitable for this case. So the correct answer will be answer C. So if you encounter this case in a real working scenario, you have to find the answer using CPT alphabetic index. So when you go to the CPT alphabetic index, first you have to go to the preventive medicine, because this part is the preventive medicine part. When you go to the preventive medicine part, then you have to go to the comprehensive. Then this patient is new. So new patient code. It will lead you to the code 99,381 to 387. So you have to go back the tabular list and confirm the answer. The second part is vaccine administration. So there are two codes you have to use. One for the route of administration, second for the name of vaccine. So first go to the administration, then go to the immunization. So here one vaccine or toxoid. So it will lead you to the code 9471 to 473. Again, go back to the tabular list and confirm the answer. The name of vaccine, again go to the index, vaccine and toxoids. There you have to find the MMRV, that is measles, mumps, rubella and varicella. It will lead you the code 9710. Again go back to the tabular list and confirm the answer. So once you confirm, the correct answer will be answer C. Question number 4. An established patient at an assisted living facility develops a cough that is diagnosed as pneumonia after radiology was performed. The physician was called in to assess her and ordered the X-ray as an outpatient. Because of her history of congestive heart failure, this acute diagnosis is more complex. The physician does a detailed interval history, a detailed examination, and considers his medical decision making to be of moderate complexity because he has spent 40 minutes with the patient at the assisted living facility and taking with the patient's family when they come for a visit. What is the correct evaluation and management code for this patient? So there are 4 answers available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
As I explained earlier, in the evaluation management type of question, first you have to look at the answer. So answers are single code of CPT, and the question also asking the evaluation and management part. So no need to worry about the disease part and what diagnosis, those kind of things. So here you have to highlight whether this patient is new or established. So here patient is established and the place is assisted living facility, and the physician done the medical decision making to be of moderate complexity, and the time spent is 40 minutes. So these 4 things we have to be highlighted. The patient new or established, place of the treatment. So physician decision making is moderate complexity, and time spent is 40 minutes. So those are the things we have to be considered. When you look at the answers, you can see 47, 48, 49, 50. So adjacent codes are used here. So you can use the elimination method. So directly go to the answer. So once you go to the answer, 99,347 is straightforward medical decision making. 20 minutes must be met or exceeded. 348 is home or resident visit, low level of medical decision making. Here 30 minutes must be met or exceeded. But in our case, it's moderate complexity. So 349 is home or resident visit, moderate level of medical decision making, and the physician spends 40 minutes must be met or exceeded. But in this case, physician spent exactly 40 minutes with the moderate complexity. So the correct answer will be answer C. So if you encounter similar scenario in your real working world, you have to use the CPT alphabetic index. So once you go to the CPT alphabetic index, you have to go to the evaluation and management services. Again, you have to go to the place that is home or resident visit. You can see assisted living facility is the home or the resident visit. There you have to go for the established patient. Here the patient is established. So it will lead you to the code 99,347 to 350. Again, go back to the tabular list as we done earlier. You have to find the answer. So once you find the answer, the correct answer will be answer C. Question number 5. A 25-year-old male is brought in by the EMS. EMS means emergency medical services to the ER for nausea and vomiting. The patient has elevated blood sugars per EMS. EMS and the physician are unable to get a history due to the patient's altered mental status. The ED physician performed the comprehensive 8-organ system exam. The provider assesses the altered mental status, the nausea and the vomiting. The provider orders an abdominal X-ray, a CT scan of the head, a urine analysis, a CBC electrolytes, a chest X-ray and an EKG. The patient needs a higher level of care and monitoring, and the patient was transferred to ICU in stable condition. Total critical care time is 25 minutes. What CPT code is reported? So there are 4 CPT codes available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
So as I explained earlier, when the questions appear in evaluation and management services, first look at the answer and read the final question. So answers are only single code, and final question is only the CPT code reported. So here asking for the CPT code, not for the disease diagnosis. ICD-10 CM codes are asked. So no need to worry about the sign and symptoms of the disease. Here you had to highlight place of the encounter. So here the patient encountered in the emergency room, and the ED physician performed the comprehensive 8-organ system examination, and the patient needs a higher level of care and monitoring, and the patient was transferred to ICU in a stable condition. So the total critical care time is 25 minutes. So those things we have to highlight. When you look at the answer, you can see all answers are nearby answers. So you can use the elimination method. So directly go to the codes. So when you look at the code, 99,285 is emergency department visit. That's the exact case here. For the evaluation and management of a patient, which requires a medically appropriate history and examination and high level of medical decision making. Okay, all things are matching here except the time. Here the time is 25 minutes, but in this code the time is not mentioned here. When you look at other code, that is 99,291, that is critical care, evaluation and management of critically ill or critically injured patient, first 30 to 74 minutes. So in this case, 30 to 74 minutes should be there. But in our case, the physician only spent 25 minutes. So this code cannot be coded here. So the correct code will be 99,285. This is not mentioned the time. Other parts are matching here, emergency department and the high level of medical decision making. So those things are matching here. So the correct answer will be answer A. 99,285. So if you encounter this scenario in a real working world, you have to use the CPT alphabetic index. So when you go to the CPT alphabetic index, so you can find the answer in two ways. One way is direct. First, you have to go to the emergency department services, then go to the subcategory of evaluation management visit. Then you will redirect you to the 99,281 to 285. Again, go back to the tabular list and find the answer. Or else you can go, as we done earlier, first go to the evaluation and management services. Within that, you have to go to the subcategory of emergency department visit. Again, it will lead you to the codes 99,281 to 285. Again, go back to the tabular list and find the answer. So once you confirm the answer will be A. Question number 6. A 74-year-old woman at the nursing facility develops confusion and becomes combative. It is discovered that she has a urinary tract infection, which is causing her confusion. She has been in the nursing facility for 5 days already, and the attending physician is called in to assess the patient and manage her care. He comes and does a detailed interval history, a detailed examination and moderate complexity medical decision making, spending about 35 minutes with the patient and writing orders. What is the correct evaluation and management code for this patient? So there are 4 adjacent codes available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, as I explained in the previous questions, here you only need to highlight the following things. The facility, that is nursing facility, and the patient is in the facility for 5 days. So the physician assesses the patient, that is moderate complexity medical decision making, and time spent is 35 minutes. When you look at the codes, all codes are adjacent codes. So you can use the elimination method, directly go to the codes. Once you go to the code, 99,307 is subsequent nursing facility care, straightforward medical decision making 10 minutes, but in our case moderate with 35 minutes. The second 308 is low level medical decision making 20 minutes. 309 is moderate level of medical decision making 30 minutes must be met or exceeded. So in our case moderate more than 30 minutes. So the correct code would be 99,309. So the correct answer is answer C. If you encounter this case in a real working scenario, you have to use the CPT alphabetic index. So once you go to the CPT alphabetic index, first you have to go to the evaluation and management services, then go to the subcategory of nursing facility. Then you have to go for the subcategory of subsequent care. It will lead you to the code series of 99,307 to 310. Again, go back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer C. Chapter 17. Anesthesia. 4 questions. The questions related to anesthesia will pertain to time reporting, qualifying circumstances, physical status modifiers, anesthesia for surgical, diagnostic, and obstetric services. Question number 1. The time reported for an anesthesia service begins and ends. There are 4 answers. Please pause the video, read the answers, and find the answer.
3, 2, 1.
Okay, the correct answer is the time reported for an anesthesia service begins and ends when the anesthesiologist begins prepping the patient, when the anesthetist is no longer in personal post-operative attendance. According to anesthesia coding conventions, the time reported for an anesthesia service begins when the anesthesiologist begins a pre-operative session, remains throughout the operative session, and ends in the post-operative session when the patient is no longer under the care of an anesthesiologist and can be transferred to post-operative supervision. Question number 2. A healthy 28-year-old male with a closed distal radius fracture received monitored anesthesia care for an orifice of the distal radius. What is the code for the anesthesia service? So there are 4 codes available with anesthesia modifier and HCPCS codes. So please pause the video, take your CPT and HCPCS code books and find the answer.
3, 2, 1.
Okay, here you have to highlight this is a closed distal radius fracture received monitored anesthesia care for an orifice of the distal radius. So when you look at the codes, you can see all 4 codes. That is, first codes are anesthesia codes. You can see all are nearby codes. You can use the elimination method to find the answer with the modifiers. So once you go to the code 1830, that is anesthesia for open or surgical arthroscopy or endoscopy procedures on distal radius, distal ulna, wrist, hand, joints not otherwise specified. So this code is clearly represent the case here. So when you look other code, anesthesia for forearm, wrist or hand cast application. So cast application is the closed method, but here is ORIF. ORIF means open reduction and internal fixation. So correct code will be 1830. So you have to remember that when you use anesthesia codes, you have to use the anesthesia modifiers for the physical status of the patient. So when you look at the anesthesia physical status modifiers, P1 is normal healthy patient, P2 is a patient with mild systemic disease, and so on. In this case, the patient is healthy, a healthy 28-year-old. So you can use the code P1, 1830 P1. But you have to remember this anesthesia is the monitored anesthesia. So if it is a monitored anesthesia, you have to use the SPCS modifier as well. When you go to the HCPCS modifier, QS is monitored anesthesia care service. So you have to use this modifier also. So the correct answer will be answer C, that is 1830 QS P1. If you encounter this case in a real working scenario, you have to use the CPT alphabetic index. So when you go to the CPT alphabetic index, first you have to go to the anesthesia, then go to the subcategory of forearm. It will lead you to the code 1810 to 820, then 830 to 860. Again, go back to the tabular list and confirm the answer. Again, you have to go to the modifiers in the front cover of the CPT book. There you will find the P1, a normal healthy patient. Also, you have to go to the HCPS modifier in the front cover of the book. You will find the code QS, that is monitored anesthesia care service. So the correct answer will be answer C. Question number 9. A 59-year-old male with a history of basal carcinoma of the parotid gland and recurrent squamous cell carcinoma of the anterior neck undergoes combined surgical excision. The otolaryngologist performs a superficial parotidectomy followed immediately by wide local excision of cutaneous lesion on the anterior neck. The anesthesiologist administers general endotracheal anesthesia, managing a difficult airway due to prior radiation fibrosis and moderate COPD, and carefully titrates vasoactive agents for hemodynamic stability. Which 2 CPT codes best report the anesthesia services for both salivary gland and neck integumentary procedures? So there are 4 codes available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is a combined surgical excision, superficial parotidectomy, followed immediately by wide local excision of cutaneous lesion on the anterior neck. The general endotracheal anesthesia given and the patient with difficult airway due to prior radiation fibrosis and moderate COPD. When you look at the answer, the first code is 0000 and 104. You can go directly to the codes and find the elimination answer. Then you can see the anesthesia modifiers, and the second code is 300, 300 and 104. So all are nearby codes. You can use the elimination method. So let's go to the codes. If you go to the code 0000, that is
Anesthesia for procedures on salivary gland, including biopsy. So first part is superficial paratidectomy. So that is included in the parotid gland, included in the salivary gland. So this code is suitable for the first case. Second case is anesthesia for all procedures on the integumentary system, muscles and nerves of head of neck and posterior trunk, not otherwise specified. So 300 is the surgical procedure done in the neck. So here you can see local excision of cutaneous lesion on the anterior neck. So both codes are suitable, and you have to consider the anesthesia modifier as well, because the patient having some diseases. So when you look at the code P3, that is a patient with severe systemic disease,
difficult airway due to prior radiation fibrosis and moderate COPD.
this code will be suitable. If you look at the code P5, that is a morbid patient who is not expected to survive without operation. But in this case, that is not mentioned. So the correct code will be A, that is 100, P3 and 300. So if you encounter this case in a real working scenario, you have to use the CPT alphabetic index. So when you go to the CPT alphabetic index, first you have to go to the anesthesia. The first case done in the salivary gland. So go to salivary glands, it will lead you to the code 100. Again, go back to the tabular list and confirm the answer. Second case done in the neck. So again, go to the anesthesia, then go to the subcategory of neck. Then it will lead you to the following code. So again, go back to the tabular list and confirm the answer. Also, you had to use the modifier. You have to look at the cover of the CPT codebook. There you will find the anesthesia modifier P3, that is patient with severe systemic disease. So the correct answer will be answer A.
Question number 4. A 42-year-old female with renal pelvis cancer receives general anesthesia for a laparoscopic left radical nephrectomy. The patient has controlled type 2 diabetes with no other comorbidities. What are the correct CPT and ICD-CM codes for the anesthesia services? So there are 4 answers available. Please pause the video, take your CPT codebook and ICD-CM codebook, then find the answer.
3, 2, 1.
Okay, here you have to highlight this patient having renal pelvis cancer, receiving general anesthesia for laparoscopic left radical nephrectomy. Also, patient having the controlled type 2 diabetes with no other comorbidities. When you look at the codes, the CPT code is 860, 840, 862, 68. So adjacent codes are used here. So you can use the elimination method to find the answer. Also, you can see the modifiers used, then ICD-10 CM code also adjacent codes. So all cases you can use the elimination method. So let's go to the code. So when you go to the code, 860 is anesthesia for extraperitoneal procedures in lower abdomen, including urinary tract, not otherwise specified. But 862 is renal procedures, including upper 1/3 of ureter or donor nephrectomy. So in case you can see patient having renal pelvis cancer and radical nephrectomy here. So 862 code may be relevant. But 868 is renal transplant recipient. So this is not the renal transplant case. This is nephrectomy, removing of the kidney. So the correct code will be 862. The anesthesia codes need physical status modifier. So in this case, the patient is not healthy, but having type 2 diabetes is controlled. So you can use the modifier P2, that is a patient with mild systemic disease. So in this case, you can finalize answer C, that is 862 with P2. So no other answers having like that. So you can finalize this one. So when you finalize this one, you can go back to the ICD-10 CM and you can look at these 2 codes. So when you look at the code C65.2, that is malignant neoplasm of left renal pelvis. You can see the renal pelvis cancer, that is left. So that is correct code. And E119 is type 2 diabetes mellitus with those complications. So all the codes are suitable for the answer C. So if you encounter this case in a real working scenario, you have to use the CPT index, ICD-10 CM index. So let's go there. So when you look at the CPT index, you have to go to the anesthesia, then go to the subcategory of nephrectomy. It will lead you to the code 862. Then you have to go to the ICD-10 CM. There you have to go to the neoplasm table. So neoplasm table in the initial parts of the ICD-10 CM book. There you have to go to the neoplasm. They are neoplastic. Then you can go to the subcategory of renal, pelvis, malignant. It is a primary cancer, so you can go to the first column of primary cancer, that is referring to you to the C65. Then for the diabetes, you can go to the index of diabetes. There you can go to the type 2, referring to E119. Then you have to add the anesthesia modifier as well, as we done in the earlier, that is P2, a patient with mild systemic disease. So the correct answer will be answer C.
Hello everyone, I am Dr. Ziyad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding. In this tutorial series, I will walk through Model Paper 1 for the AAPC CPC Examination. I'll share quick techniques to find answers very easily, along with the detailed explanation to help you to understand the key concepts.
Chapter number 18, Cases. There are 10 cases with one question each. Each case will test your ability to accurately quote medical record documentation using CPT, ICD-10-CM and HCPCS Level II codes. Cases are coming with a long description, so you can download the cases, read yourself and find the answer. So please read the description to download the all 10 cases in PDF format. The last 10 MCQs of the AAPC CPC exam is cases, but the cases are very long one to read, so you may find difficult to read because of the time constraint. But you can use some techniques to find the answer very quickly. Ideally, you have to read all the description and read the question and find the answer. For a shortcut, due to the time constraint, you can use some tricks to find the answer. The first one is you have to read the post-operative diagnosis, that is for the ICD-10-CM code. Second one, you have to read the name of the procedure performed, that is for the CPT code. And then you have to read the final question, then look at the answers. Finally, you have to use the elimination method to find the answer. So this may be confusing what I am saying. So when you go to the cases, you will understand what I am saying here. The case 1 is pre-operative diagnosis, recurrent pleural effusion secondary to metastatic breast cancer. Post-operative diagnosis, recurrent left pleural effusion secondary to metastatic breast cancer. Procedures performed, left-sided ultrasound-guided thoracocentesis with therapeutic drainage pleural cytology collection. So anesthesia giving is local anesthesia with monitored sedation. There is a procedure description, is a bigger one. The final question is, what are the CPD and ICD-10-CM codes for the procedure? So you can see one CPT, one ICD-10 codes are available for each question. So please pause the video, take your CPT and ICD-10-CM code books and find the answer.
3, 2, 1.
As I explained earlier at the beginning of this video, for these 10 cases, you can find the answers very easily with reading only the post-operative diagnosis and the procedures performed. 70% of the questions, you can find the answer directly with these two. So the pre-operative diagnosis is a tentative diagnosis, not the confirmed diagnosis. So you can't use this unconfirmed diagnosis for the ICD-10-CM coding. So you have to highlight the post-operative diagnosis. So in this case, recurrent left pleural effusion secondary to metastatic breast cancer is the post-operative diagnosis. That means it's a confirmed diagnosis. And the procedure performed, this procedure performed is the one that is help you to find the CPT code. So the procedure performed here is left-sided ultrasound-guided thoracocentesis with therapeutic drainage pleural fluid cytology collection. So this sentence may help you to find the CPT code. In case of if you are unable to find the code with these two items, then you have to read the description for the final diagnosis. So most of the cases, around 70% of the cases, you will find the answers easily with the post-operative diagnosis or the final diagnosis and the procedure performed. Okay, so in this question it's asked for the CPT and ICD-10-CM codes. When you look at the CPT code, you can see all adjacent codes are used, 32,555, 54 and 57. When you look at the ICD-10-CM code, they also adjacent codes, C96, C78, C79 and C78. So you can use the elimination method to find the answer. Okay, so let's find the CPT code. So here you can see the procedure performed is left-sided ultrasound-guided thoracocentesis with therapeutic drainage pleural fluid cytology collection. So when you look at the codes, 32,554 is thoracocentesis, needle or catheter aspiration of pleural space without imaging guideline. 32,555 is with imaging guideline. So in this case, you can see the procedure performed is left-sided ultrasound-guided thoracocentesis. So ultrasound-guided imaging guidelines. So the correct code may be 555. So if you look at other answers like 557, that is pleural drainage percutaneous with insertion of indwelling catheter with imaging guidelines. But here this is not the pleural drainage, this is the thoracocentesis. With the thoracocentesis, we can collect the pleural effusion. So the correct code for this procedure is 32,555. So without reading the whole description, you can directly find the answer. This is the shortcut method to find the answer in the exam. But in a real working scenario, you have to read the full description and you have to find the answer. So the CPT code will be 555. So A and C are suitable for the moment. You can eliminate B and D. So let's go to the ICD-10 CM code. When you look at the ICD-10 CM code, so we have already eliminated answer B and D. So we have to check these two codes, 78.2 and 96.2. So 96.2 is malignant mast cell neoplasm. That is not suitable here. C78.2 is that is secondary malignant neoplasm of pleura. So that is the case here. When you look at the post-operative diagnosis, recurrent left pleural effusion secondary to metastatic breast cancer. So in this case, the secondary malignant neoplasm on the pleural area, that is a pleural effusion here. So if you look at the other answer, 79.52, secondary malignant neoplasm of bone, but here in the pleura. So this also not suitable. So correct answer for this question is answer C. So if you encounter this case in a real working scenario, you have to use the alphabetic index of CPT and ICD-10 CM codes. So let's try that. So when you go to the CPT alphabetic index, in this case, the procedure is thoracocentesis. So go to the index of thoracocentesis. There you will be redirected to the codes 32,554 and 55. Again, go back to the tabular list and you can find the answer. Or else you can go to the aspiration because this procedure is the aspiration. So again, go to the aspiration, chest. There also you can go to the sub-index of thoracocentesis. Again, it will lead you to the codes 32,554 and 555. Again, go back to the tabular list and confirm the answer. So when you go to the ICD-10 CM alphabetic index, you have to go to the tables of neoplasm. The tables of neoplasm on the initial part of the ICD-10 CM code book. Table of neoplasm, you have to go to the category of pleura or pleural cavity. There you have to look at the secondary column. There it will lead you to the code C78.2. So this is the table of neoplasm. You can see the pleura, pleural cavity. These parts are here. Then you have to go to the secondary column. The secondary column says C78.2. So the correct answer will be answer C. Case number 2, pre-operative diagnosis, ST elevation myocardial infarction, that is STMI of the anterior wall. Post-operative diagnosis is the same, STMI of the anterior wall. Procedure performed, emergency percutaneous coronary intervention, PCI of the left anterior descending artery with placement of a stent. Anesthesia, conscious sedation with midazolam and fentanyl. And the procedure description is here. So you can download this case in the description of this video. So the final question is, what are the CPT and ICD-10 CM codes for this procedure? So there are 4 answers available, CPT and ICD-10 CM codes. So please pause the video, take your CPT and ICD-10 CM code books and find the answer.
3, 2, 1.
Okay, as I mentioned in the initial part of the video, you had to highlight main 2 things. One is the post-operative diagnosis and another one is the name of the procedure. So the post-operative diagnosis is ST elevation MI of the anterior wall and the procedure performed is emergency percutaneous coronary intervention of the left anterior descending artery with placement of a stent. So the question is CPT and ICD-10 CM codes. So you can directly go to the codes and find the answer. So when you look at the code, the CPT code is 92,924, 928, 920. So adjacent codes are used here. And similarly, the ICD-10 CM code also I21 point something there. So you can use the elimination method to find the answer. So let's go directly to the codes. So when you look at the codes, 92,920 is percutaneous transluminal coronary angioplasty, single major coronary artery or branch. But here it is not mentioning about the placement of stent. 924 is percutaneous transluminal coronary atherectomy with coronary angioplasty when performed, single major coronary artery or branch. So that also not mentioning the stent placement. So if when you look at the other code, 928, percutaneous transcatheter plus placement of intracoronary stents with coronary angioplasty when performed, single major coronary artery or branch. So here when you read the procedure performed, emergency percutaneous coronary intervention of the left anterior descending artery with placement of stent. So one artery, one stent. So that this code is correctly mentioning the procedure here. So you can find the correct CPT code as 92,928. So you can eliminate other 2 answers. A and B you can eliminate and you can use the C and D. So let's confirm the ICD-10 CM code. So when you go to the ICD-10 CM, the I-21.01 is ST elevation MI, myocardial infarction involving left main coronary artery. So in our case, this is left anterior descending artery. So that is correct code. When you look at other code, I-21.4 non-ST elevation MI, but our case is ST elevation MI. So this is not correct. So correct answer for this question is D, that is 92,928, and ICD-10 CM code is I-21.01. So if you encounter this case in a real working scenario, you have to use the CPT and ICD-10 CM alphabetic indexes. So when you go to the CPT alphabetic index, here you have to go to the index of stent intravascular. There you have to go to the subcategory of placement. In the placement, you can go to the intravascular stent. It will lead to the following series of codes. So it also including the 92,928. So you have to go back the tabular list and have to confirm the answer. When you go to the ICD-10 CM alphabetic index, this case is the infarction. So you have to go to the infarct or infarction. That is the index. Then you have to go to the subcategory of myocardial or myocardium. Then you have to go to the subcategory of ST elevation, that is ST elevation MI. So it will give you the codes for subcategory of left main coronary artery, that is I-21.01. Again, you have to go back to the table list and confirm the answer. Once you confirm, the correct answer will be answer D. Question number 3, history. Low grade fever at home. She has had some lumps in the abdominal wall, and when she injects her insulin, it does seem to hurt there. She stopped 4 of her medications, including Neuronin, Depakote, Lasix, and Primarin, and overall she feels quite well. Unfortunately, she has put on 20 pounds since our last visit. Then it shows examination, then assessment. The assessment says diabetes mellitus type 1, diabetic neuropathy, and acute sinusitis. The plan is, at this time, I have recommended the addition of some Keflex for her acute sinusitis. I have given her chair for the shower. They will not cover her glycerna anymore, so a note for that will be required. What diagnosis code are reported? So here it's only asking for ICD-10 CM codes. So please pause the video, take your ICD-10 CM code book and find the answer.
3, 2, 1.
Okay, in this case, you had to highlight what is the final diagnosis. So it starts with the history, then examination, finally the assessment. So assessment says 3 diagnoses, that is diabetes mellitus type 1, diabetic neuropathy, and acute sinusitis. So you need only these 3 to find the codes. Other histories and examination parts are no need. Sometimes you may need the plan part. So if you encounter these kind of questions, you can go for the final assessment or the final diagnosis here. So when you look at the codes, E and J codes are used here. So you can use the elimination method to find the answer. Okay, when you go to the code E10.2, that is type 1 diabetes mellitus with kidney complications. But in this case, it is not nephropathy. Nephropathy is the kidney complication, but here it is neuropathy. Neuropathy is the nervous system problem. So you have to be careful. Sometimes you may confuse with the nephropathy with the neuropathy. So this is neuropathy, not the nephropathy. So this code is not suitable here. When you look at the other codes, E10.40, that is type 1 diabetes mellitus with diabetic neuropathy unspecified. So that is the correct code here, E10.4, the type 1 diabetes mellitus with diabetic neuropathy. When you look at other codes, E11.40, that is type 2 diabetes mellitus with diabetic neuropathy. But in our case, the diabetes mellitus is type 1. So you have to be careful whether it's type 1 or type 2. So with type 1 with diabetic neuropathy, so correct code will be E10.40. But the patient have other diagnosis as well, that is acute sinusitis. So when you go look at the other code, that is J01.9 is acute sinusitis unspecified. J0190 is acute sinusitis. J01.01 is acute recurrent sinusitis unspecified. So this is not mentioned as recurrent, so acute sinusitis. So correct code will be B, that is E10.40 and J01.90. So if you encounter this case in a real working scenario, you had to use the ICD-10 CM alphabetic index. When you go to the ICD-10 CM alphabetic index, first you have to go to the diabetes or diabetic, then go to the subcategory of type 1. In the type 1, we have to go to the with neuropathy. It will lead you to the code E10.40. Similarly, for the other diagnosis, acute sinusitis, you have to go to the sinusitis, then go to the subcategory of acute. It will lead you to the code J01.90. So the correct answer will be answer B. Case number 4. Preoperative diagnosis, rapidly enlarging suspicion lesion of the patient's right forehead. Procedures performed, wide local excision with intermediate closure of the right forehead. Indications, the patient is a 78-year-old white male who recently in the last month or so noticed a rapidly enlarging suspicious lesion on the right side of the forehead. So the procedure distribution is here. The final diagnosis is skin right forehead, wide local excision, keratoacanthoma, possible squamous cell carcinoma, margins are free of tumor. So what are the CPT and ICD-10-CM codes are reported for this encounter? There are CPT and ICD-10-CM codes are available. So please pause the video, take your CPT and ICD-10-CM code books and find the answer.
3, 2, 1.
Okay, in this case, no need to highlight the preoperative diagnosis, but the postoperative diagnosis not mentioned here, but it is mentioned as the final diagnosis on the down. So the final diagnosis is keratoacanthoma, possible squamous cell carcinoma, margins are free of tumor. The procedure performs is a wide local excision with intermediate closure of the right head. So normally the final diagnosis or the postoperative diagnosis and procedures performed is enough for finding the answer. But in this case, you may need to read the description as well. I'll tell you how it's needed. So if you go to the course, 11,442 is exercise diameter 11.1 to 2.0. And next code, that is 12,051 is repair intermediate wounds of face, ears, eyelids, nose or lips or mucous membranes 2.5 centimeter or less. Other code is 12,052 is 2.6 centimeter to 5 centimeters. So these measurements may not be available in the procedures performed. So in this case, you have to read the description as well. So once you go back, here you can see this maximum of diameter of 11 centimeter. This head 0.3 centimeter margin designed for total resection of 1.7 centimeter. So total resection area is 1.7 centimeter, and also the total length of this incision was 3 centimeter. So in this case, the total resection area, that is 1.7 centimeter. So that is included in the exercise diameter 1.1 to 2 centimeter. So the first code will be 11,442, and the closure, that is intermediate closure, you can see that intermediate closure is already mentioned. The closure size is 3 centimeter. So you can see 12,051 is repair intermediate wounds, that is 2.5 centimeter or less. 12,052 is 2.6 centimeter to 5 centimeter. So this 3 centimeters including in this range. So correct CPT codes will be 11,442 and 12,052. Here modifier 51 also needed. The modifier 51 is multiple procedures. Here you can see the wide local excision, also intermediate closure. So two different things we have coded with the two different CPT codes. So in this scenario, you have to use the modifier. So modifier 51 is used for the multiple procedures. When you look at the ICD-10-CM codes, it says L85.8 and C44.529. Those kind of codes are available. So the final diagnosis here is keratoacanthoma, possible squamous cell carcinoma. So in this case, this squamous cell carcinoma is not the final diagnosis. It says possible. So they are suspecting squamous cell carcinoma, but this is not finalized. So you can't use the code for the basal cell carcinoma here. But keratoacanthoma, you have to go to the CPT code book. L85.8 is for keratoacanthoma. Correct answer will be answer A, that is 11,442 with the modifier 51 and 12,052 with the ICD-10-CM code L85.8. So if you encounter this case in a real working scenario, you have to use the alphabetic index. So when you go to the CPT alphabetic index, first you have to code the excision part, then the repair part. So for the excision part, you have to go to the index of excision, then go to the subcategory of lesion, then go to the subcategory of skin, then go to the subcategory of benign. So it will lead you the codes 11,400 to 471. Again, you have to come back the tabular list and have to find the answer. When you go to the other code, that is intermediate closure, that is repair, again go to the index of repair, then go to the subcategory of skin, then subcategory of wound, then go to the intermediate. So it will lead to the following code series 12,031 to 58. Again, you have to go back the tabular list and confirm the answer. For the ICD-10-CM alphabetic index, so this is the keratoacanthoma. So when you go to the index of keratoacanthoma, it will lead you to the code L85.8. So the correct answer will be Answer A. But keep in mind, when you go to the index, alphabetic index of ICD-10-CM, it will show you L85.8 is keratoacanthoma. But when you go to the tabular list, L85.8 is other specified epidermal thickening, cutaneum horns. So this is the code for the keratoacanthoma. You may be confused, the L85.8 not directly mentioning the keratoacanthoma, but that is in the index. The same thing, other specific epidermal thickening is itself code for the keratoacanthoma. Case number 5. Chief complaint. The patient is a 42-year-old female with infected right axillary hidradenitis. The procedure note is there. The final question is, what are the CPT and ICD-10-CM codes are reported? So there are 4 answers available with ICD-10-CM and CPT. So please pause the video, take your CPT and ICD-10-CM code books and find the answer.
3, 2, 1.
Okay, in this case, you can see there's no specific diagnosis given separately. Also, there's no specific procedure name given separately. So these kind of questions, you have to read the full description. As I mentioned earlier, of the 10 cases, for 7 cases, you can find the answer with the topics. But this kind of cases, we have to read the full description or full procedure note. So here the procedure note is, with the patient in supine position and under general anesthesia, the right axilla was prepped and wrapped in the usual sterile fashion. A skin incision was made in the axilla to excise most of the hidradenitis threads. The incision was carried out down to the subcutaneous tissue. The underlying subcutaneous tissue was excised. Bleeding points were controlled by means of electrocautery. The subcutaneous tissue were closed in intermediate layers with suture of Vicryl. The skin edges were stapled together and a dry sterile dressing was applied. So in this case, the diagnosis is axillary hidradenitis, and the procedure performed is incision and drainage with the intermediate layer closure. So those are the things you need to highlight here. So when you look at the answers, the CPT code is 11,450 and 51 are there, and also 12,000 code also used here, and the ICD-10-CM codes L73 and L03 codes are used. So you can use the elimination method to find the answer. So let's go directly to the codes. So when you look at the codes, 11,450 is excision of skin and subcutaneous tissue for hidradenitis, axillary, with simple or intermediate repair. So this code is exactly mentioned the scenario here. So excision of skin and subcutaneous tissue for hidradenitis, axillary, with the intermediate repair. So you can use the 11,450 code and the procedure done in the right side, so you can use the modifier right RT. So the answers A and C may be suitable here. So when you look at the repair code, 12,031 is repair intermediate wounds of skull, axilla, trunks and extremities. But in this case, the 11,450 code itself mentioned the repair as well. So it says with intermediate repair. So no need for the repair code separately. It is included in the 11,450 code itself. So when you look at the ICD-10-CM code, so these 2 answers are suitable, A and C. So you can go and check the code L73.2. So when you check the code L73.2, that says hidradenitis suppurata iva. So this is correct code for this scenario. So the correct answer will be answer C, 11,450 right and L73.2 ICD-10-CM code. So if you encounter this code in a real working scenario, you have to use the alphabetic index. So go to the CPT alphabetic index. There you have to go for the index of hidradenitis. There you have to go to the subcategory of excision. It will lead you to the code 11,450 to 11,471. Again, go back the table list and have to confirm the answer. If you go to the ICD-10-CM alphabetic index, you can directly go to the code hidradenitis, that is axillaris suppurativa. It will lead you to the code L73.2. So the correct answer will be answer C. Case number 6. Pre-operative diagnosis, painful L2 vertebral pathological compression fracture. Post-operative diagnosis, same, painful L2 vertebral pathological compression fracture. Name of the operation is L2 kyphoplasty. And what are the CPT and ICD-CM codes are reported? So there are 4 answers available. So please pause the video, take your CPT and ICD-10-CM code books and find the answer.
3, 2, 1.
Okay, in this case, we have to highlight the post-operative diagnosis, that is painful L2 vertebral pathological compression fracture. The name of the operation is L2 kyphoplasty. So the questions are here. So it is asking for the CPT and ICD-10 CM codes. So when you look at the answer, the CPT code is 22,540, 510, 13, 14. So adjacent codes are used here. And also when you look at the ICD-10 CM codes, M84 and S32 codes are used here. So you can use the elimination method to find the answer. So let's go to the codes. So when you look at the code, 22,513 is percutaneous vertebral augmentation, including cavity creation using mechanical device, one vertebral body, unilateral or bilateral cannulation, inclusive of all imaging guidelines for thoracic. 22,542 is lumbar. So this procedure is called the kyphoplasty. You can see within bracket it says the kyphoplasty. So in our case, the name of the operation is L2 kyphoplasty. L2 is the lumbar, second lumbar vertebra in the kyphoplasty. So the correct CPT code will be 22,514. So when you look at the code 22,514, the A and D answers are possible. So when you look at the ICD-10 CM codes here, M84.48XA, M80.08XA. So when you look at the code 84.48, that is pathological fracture other side. So this post-operative diagnosis is also pathological compression fracture. So that code is suitable here. But why this X and A is here? According to the CPT guidelines, the seventh character is required. This is the initial encounter because he had a pathological compression fracture. The A is reported for the seventh character and X is reported in the sixth position to keep the seventh character in the seventh position. So the correct answer will be answer A. So if you encounter this case in a real working scenario, you have to use the alphabetic indexes. First, you have to go to the CPT alphabetic index. There you have to go to the index of kyphoplasty. It will lead you to the following code series 22,513 to 515. Again, go back the tabular list and you have to confirm the answer. When you go to the ICD-10 CM alphabetic index, first you have to go to the fracture, then go to the subcategory of pathological, then go to the subcategory of vertebrae. It will lead you to the code M84.48. Then this code needs the 7 character coding. So the A is used for the acute onset and the X is for the placeholder, as I explained earlier. So the correct answer will be answer A. Case number 7. Pre-operative diagnosis, grade 3 squamous cell carcinoma of penis with inguinal lymphatic metastasis. Post-operative diagnosis, grade 3 squamous cell carcinoma of penis with inguinal lymphatic metastasis. Procedure performed, laparoscopic bilateral pelvic lymphadenectomy. And the description of procedure is there. So the final question is, what CPT and ICD-10 CM codes are reported? So there are 4 answers available. Please pause the video, take your CPT and ICD-10 CM code books and find the answer.
3, 2, 1.
Okay. As I mentioned in the first questions, these type of cases, you no need to read full description. You can find the answer using this post-operative diagnosis and the procedure name. Here, the pre-operative diagnosis have no value because it is a tentative diagnosis. The post-operative diagnosis you have to consider, that is grade 3 squamous cell carcinoma of penis with inguinal lymphatic metastasis. But in this case, both the pre and post-operative diagnosis are same. And the procedure performed is laparoscopic bilateral pelvic lymphadenectomy. So adjacent codes are used here. So you can use the elimination method. Similarly, the ICD-10 CM code also C60, C77. Both codes are used interchangeably. So again, for that also you can use the elimination for that. So let's go to the codes directly. Once you go to the code, 38,570 is laparoscopy surgical with retroperitoneal lymph node sampling, biopsy single or multiple. So it says laparoscopy surgical with retroperitoneal lymph node sampling, biopsy single or multiple. But 571 says with bilateral total pelvic lymphadenectomy. But in our case is laparoscopic bilateral pelvic lymphadenectomy. So that 38,571 is the suitable code for this. So there's no additional code needed. The laparoscopy surgical is continued with the code here. So laparoscopy surgical with bilateral total pelvic lymphadenectomy. So one code is enough for this case. So 38,571. So you can eliminate answer C, answer B and C. When you look at the ICD-10 CM codes, you can see here grade 3 squamous cell carcinoma of penis with inguinal lymphatic metastasis. So there are 2 diagnoses available here. So when you look at the code C77.4, secondary and unspecified malignant neoplasm of inguinal and lower limb nodes. 77.9 is secondary and unspecific malignant neoplasm of limb node unspecified. So in this case, it is inguinal limb nodes, secondary inguinal limb nodes. So you can use this code. C77.4. For the squamous cell carcinoma of penis, you can use the code C60.9, that is malignant neoplasm of penis unspecified. So the correct answer will be answer A, that is CPT code 38,571 and ICD-10-CM code is C77.4 and C60.9. So if you encounter this case in a real working scenario, you had to use the alphabetic index of CPT and ICD-10-CM. So let's do that. So in the alphabetic index, this part is tricky. So if you see this here, the procedure performed is laparoscopic bilateral pelvic lymphadenectomy. So the procedure is lymphadenectomy. But if you go to the alphabetic index of lymphadenectomy, you can't come to this code. 38,571 is not there when you go with the lymphadenectomy. But in this case, you have to start with the laparoscopy. So code start with the laparoscopy, then go to the subcategory of limb system, then go to the subcategory of lymphadenectomy. It will lead you to the code 38,571 and 72. Then go back to the tabular list and you have to confirm the answer. So when you take the ICD-10-CM alphabetic index, you can go to the table of neoplasm. That is the initial part of the ICD-10-CM code book. In the table of neoplasm, then you can go to the category of neoplasm or neoplastic. Then go to the subcategory of limb, then lymphatic channel, not elsewhere classified. It's gland within bracket secondary. It will give inguina or inguinal. Then go to the second column, that is malignant secondary, guiding you to the code C77.4. For the carcinoma of penis, again you have to go to the table of neoplasm, then go to the neoplasm and neoplastic, go to the subcategory of penis. It will lead to the malignant primary, that is C60.9. So the correct answer will be answer A. Case number 8. Pre-operative diagnosis. Multiple varicose veins with severe pain in the leg. Post-operative diagnosis same. Procedure: removal of multiple varicose veins, right lower leg, involving both the greater and lesser saphenous veins. Anesthesia general. The procedure description is there. So the final question is, what are the CPT and ICD-10-CM codes are reported? So there are 4 answers available. Please pause the video, take your CPT and ICD-10-CM code books and find the answer.
3, 2, 1.
So here, the diagnosis, the pre and post-operative diagnosis are same. So that is multiple varicose veins with severe pain in the leg. So that is useful for the ICD-10-CM coding. For CPT, the procedure is removal of multiple varicose veins, right lower leg, involving both the greater and lesser saphenous vein. So there should be 2 codes for great saphenous vein and the lesser saphenous vein. So you can use the elimination method to find the answer. So go directly to the codes. So when you look at the code 36,475, that is endovenous ablation therapy of incompetent vein extremity, inclusive of all imaging guidance and monitoring. But in our case, it's varicose vein, that is removal of greater and lesser saphenous vein. So this code is not suitable. When you look at other codes, 37,722 is ligation, division, and stripping long, that is greater saphenous vein from the saphenofemoral junction to knee or below. 37,718 is ligation, division, and stripping of short saphenous vein. So for long saphenous vein, you can use this code. For short saphenous vein, you can use this code. So 22 and 18. So C, yeah, the answer C is suitable. With the CPT only, we can find the answer. 37,722 and 37,718 with the modifier RT, right? Modifier RT for right and 51 for the multiple procedure. So when you look at the ICD-10-CM code, that is I83.81, that is varicose veins of lower extremities with pain. 811 is varicose veins of right lower leg. So this I83.811 is suitable for the ICD-10-CM. So the correct answer will be answer C. So if you encounter this case in a real working scenario, you had to use the alphabetic index of CPT and ICD-10-CM. So let's see how to do that. So in this case, we are removing the varicose vein. So the first term will be removal. So the CPT alphabetic index, go for the term removal, index of removal. Then go for the subcategory of veins. Then go for the subcategory of venous. So saphenous. So it will lead you to the code 37,718 to 735. In the saphenous area, find code for the greater and lesser saphenous veins. So when you look at the ICD-10-CM alphabetic index, so this case is multiple varicose vein. You have to start the search with varicose vein. So varicose vein, so it will lead you to see varix. Again, look in the alphabetic index for varix. Then go subcategory of leg. Asymptomatic right with pain and you are directed to I-83.811. Case number 9. Preoperative diagnosis, history of rectal carcinoma. Postoperative diagnosis, history of rectal carcinoma. Procedure performed, closure of loop ileostomy with small bowel resection, enteroenterostomy with intraoperative flexible sigmoidoscopy. And description of procedures given. The final question is, what are the CPT and ICD-10-CM codes are reported? So there are 4 answers available with multiple codes. So please pause the video, take your CPT and ICD-10-CM code books and find the answer.
3, 2, 1.
Okay, in this case also, as I explained in the introduction, you had to highlight the postoperative diagnosis and the procedure performed. The postoperative diagnosis is history of rectal carcinoma. Procedure performed is closure of loop ileostomy with small bowel resection and enteroenterostomy with intraoperative flexible sigmoidoscopy. So when you look at the codes, the CPT codes are 44,620, 25, 2 codes, and 41,120, 45,330. So you can use the elimination method to find the CPT answers. Similarly, the ICD-10-CM code also, the adjacent codes are used. So both cases you can use the elimination method. So once you go to the code directly, 44,620 is closure of enterostomy, large and small intestine. 44,625 is with resection and anastomosis of other than colorectal. 44,626 is with resection and colorectal anastomosis. Example, closure of Hartmann type procedure. So here you can see the closure of loop ileostomy with small bowel resection and enteroenterostomy with intraoperative flexible sigmoidoscopy. So in this case, the correct code will be 44,625. You should read the both codes together because the semicolon is here. So closure of enterostomy, large or small intestine. So here we have using the small intestine with the resection. We are resecting the small bowel resection and anastomosis other than colorectal. So here we are anastomosing enteroenterostomy. Correct CPT code will be 44,625. So one code is enough to describe this procedure. So when you look at the ICD-10-CM codes, the Z codes are used here. So Z43.2 and 43.2 are used in all 4 answers. So when you read the code 43, Z43.2 is encounter for attention to ileostomy. So this case is for ileostomy. So that this code should be there. And other diagnosis, history of rectal carcinoma. So history code. So when you look at the code Z85.048, that is personal history of other malignant neoplasm of rectum, rectosigmoid junction and anus. So here our history is rectal carcinoma. So that carcinoma also included in this code. So the correct answer will be answer B. So if you encounter this case in a real working scenario, you have to use the alphabetic indexes. So when you go to the CPT alphabetic index, you have to start the search using the term enterostomy because the procedure here is enterostomy. So go to the alphabetic index, search the term enterostomy, then go to the subcategory of closure. So it will lead you to the following 4 codes. Again, go back to the tabular list and check each code. When you go to the ICD-10-CM alphabetic index, here you have to start the search with attention to. So here the patient come for the attention to the ileostomy. So the correct code will be Z43.2. Then you have to go for the history code because the diagnosis is history of rectal carcinoma. So again, go to the history and go to the subcategory of personnel of and the subcategory of malignant neoplasm of rectum, not elsewhere classified. So that will lead you to the code Z85.048. So the correct answer will be answer B. Case number 10. The final question of the cases series. Preoperative diagnosis, right thyroid follicular lesion. Postoperative diagnosis, right thyroid follicular lesion. Operative procedure, right thyroid lobectomy. And the findings and the description of procedure are described here. So the final question is, what are the CPT and ICD-10-CM codes are reported? So there are 4 answers available. Please pause the video, take your CPT and ICD-10-CM code books and find the answer.
3, 2, 1.
Okay, as I explained earlier, these kind of questions, you have to highlight post-operative diagnosis and operative diagnosis, then directly go for the question and answers to save the time. So here the post-operative diagnosis is right thyroid follicular lesion, operative procedure is right thyroid lobectomy. Once you look at the answer, The CPD codes are 60,220, 240, 210 there. And ICD-10 CM codes are D44.0 and E04.1. So adjacent codes are used here. So you can use the elimination method to find the answer. Directly go to the answer. So once you go to the answer, 60,210 is partial thyroid lobectomy, unilateral with or without isthmectomy. In our case, right thyroid follicular lesion, right thyroid lobectomy. So this is not seen as a partial, so we have to take as a complete. So 60,220 is total thyroid lobectomy, unilateral with or without isthmectomy. Whether the isthmus is removed or not, you have to read in the description. But anyhow, if it is removed or not, this code will be suitable because with or without isthmectomy. So the total thyroid lobectomy, unilateral. You can see right thyroid lobectomy. So this code 60,220 is suitable here. If you look at other codes, 220 is thyroidectomy total or complete. But in this case, it's a right-sided. So the correct CPD code will be 60,220. So you can eliminate the answer C and B. So let's look at the code D code and E code. D44.0 is neoplasm of uncertain behavior of thyroid gland. E041 is non-toxic single thyroid nodule. So here you can see right thyroid follicular lesion. So follicular lesion we can consider as the nodule. So the correct ICD-10 CM code will be E04.1. So the correct answer will be answer D, 60,220 and E04.1. So if you encounter this case in a real working scenario, you had used the alphabetic index. So when you go to the CPT alphabetic index, here the procedure is lobectomy. So you have to start the search with the index of lobectomy, then go to the subcategory of thyroid gland, then go to the subcategory of total. It will guide you to the codes 60,220 to 225. Again, go back to the tabular list and confirm the answer. When you go to the ICD-10 CM alphabetic index, here the follicular lesion. So if it is mentioned as follicular lesion, you have to take it as the nodule. So it is described in the guideline. So if it is a follicular lesion, you have to search for the nodules. So in the nodules, you have to go to the subcategory of nodular, then go to the subcategory of thyroid. So it will lead you to the code E04.1. Again, go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer D. So this is the end of the cases 10 and also the end of the model paper 1. So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel, and if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.